is the most sweeping economic recovery package in our history.
Initially, right after the crisis, there was this big stimulus.
Laura Merling, again from the International Trade Union Confederation.
And, all the banks were bailed out and some companies were bailed out. And then about 2 years later, around 2010, there was this push to now all of a sudden worry about the deficit and cut spending.
Yes, those bailouts were eventually paid back with interest. But remember what was going on right then. The Obama administration was trying to get the Affordable Care Act through Congress, and midterm elections were just around the corner.
He gets into the idea that, the deficit is something that we should worry about, supposedly to, win Republican support.
The 2010 midterm elections come and go. Democrats lose 6 seats in the Senate, 63 seats in the House, to Republicans who ran on the idea that government was too big and spending was too high. So a couple of months later, at the 2011 State of the Union,
every day, families sacrifice to live within their means. They deserve a government that does the same.
Congressman Paul Ryan, not yet Speaker of the House, but then the chairman of the House Budget Committee, gave the Republican response.
Endless borrowing is not a strategy. Spending cuts have to come first.
And they did. Cuts to spending on education, the Defense Department, community action programs, and state and local governments still recovering from the recession.
And that, it's widely understood now, really deepened the recession and made the recovery much slower than it otherwise would have been.
So when you say austerity, I think of how much lower family incomes were prior to the pandemic than they needed to be.
But look, if I'm a citizen of this economy trying to get by in difficult times and I don't have as much money to tighten my belt, why should
Hey there, everybody.
Hi there.
Good evening.
Hello.
Hi, all.
Okay, hello everybody. Trying to check and make sure we're all here. Looks like we have all board members here. Am I right?
Yes.
Great. Okay, so I'd like to call to order the November 16th, 2020 regular board meeting of the State College Area School District Board of Directors. I'd like to announce the board held an executive session November 2nd regarding negotiations, personnel, and board development, and on November 12th regarding personnel. At this time, I'd like to ask that you all join in the Pledge of Allegiance. I pledge allegiance to the flag
Flag
of
the United States of America
and to the
to the
republic
republic for which it stands,
one
nation,
under
God,
God, indivisible,
indivisible, with liberty and justice for all.
Thank you. I'd like to welcome everyone who's here with us this evening, viewing remotely. Board members, with an agenda before you, are there any changes to the agenda as presented? Okay. For our audience this evening, public comment will be provided at the end of the meeting, as well as prior to any action items or votes by the board. At this time, Dr. O'Donnell will be reviewing some of the housekeeping items related to the COVID-19 pandemic in our virtual format.
Sure. Thank you. As a result of COVID-19, this will be a virtual meeting via Zoom webinar. Nick Zepp will serve as host of tonight's virtual meeting. The IT help desk is available during the meeting if the community encounters technical difficulties. You may email itsupport@scasd.org or call us at 814-231-7743. A few notes for participants. When board or community members want to make a comment or ask a question, please use the raise hand feature in the Zoom program accessed under the participants tab. Aside from the public comment section, as Amber mentioned, which occurs at the end of the agenda, community members may comment on any individual voting items prior to a board vote. The host will lower hands and mute or unmute speakers as necessary to assist with the flow of the meeting. As a result of the pandemic, all board members are participating remotely. The digital format allows us to respect the need to limit the size of indoor gatherings, but still keep public participation available to as many people as possible. Policy 9 provides that where discretion is directly and/or by implication granted to the board may depart from policy. Given the times we're in and circumstances that we find ourselves, the board is choosing to exercise its discretion and depart from Policy 3's requirement of at least 4 board members being physically present. The board will return to strict adherence with Policy 3 when conditions allow. Thank you.
Thank you, Dr. O'Donnell. I'd like to call now on the board secretary for a roll call of board members.
Dr. Bader,
Here.
Ms. Bedell,
Here.
Ms. Brandt,
Here.
Ms. Concepcion,
Here.
Dr. Duffy,
Here.
Mr. Fazzard,
Here.
Mr. Hutchinson,
Here.
Mr. Leos,
Here.
Ms. Sidney.
Here.
Okay, thank you, Ms. Tressler. I'd like to call now on Dr. Bader, who's going to be recognizing one of our retirees with greater than 25 years experience in the district.
Sorry, I didn't have that pulled up, but I will have it in one split second.
Okay.
Already. Sorry. So, Gloria Samsel is retiring on January 29th, 2011 with 37 and a half years in the district. Gloria's career at State High began on May 9th, 1986. She started as a school guidance secretary, serving in that role for 3 years before becoming a secretary to the principal. From 1994 to 1996, she worked as a building secretary in both the North and South buildings, then worked for 8 years as an information systems secretary. In 2004, she returned to being a building secretary, and from 2013 to the present, she had been the Career and Technical Center secretary. CTC Director Ben Morden praised Gloria's service, saying, "It has been a pleasure having Gloria to welcome me on board and help me transition to my new home. She is one of the most caring and dedicated people I have ever worked with. She is constantly working to do what is best for our students and teachers as she relentlessly pursues her objectives and brings excellence to our department. In addition to her outstanding efforts, she also brings a great deal of knowledge and expertise related to the CTC department and our district. She has been a very valuable team member and she will be greatly missed by all. We wish her a happy and healthy retirement and hope she enjoys her well-deserved time with her family and friends after a long, successful career at SCASD." CTC technology teacher Doug Ripka said, "Gloria is a rock. She has worked here longer than me, and since she became our CTC secretary, she has worked hard for both former CTC director Sharon Perry and Ben, as well as all of us teachers in CTC, helping us order things, arrange meetings, keep track of our CTSO treasuries. Her devotion to getting things right is exceptional, and she is very good at doing front of the house, dealing with the public, and back of the house, tabulating reports and keeping records. Gloria always keeps an upbeat attitude even when things are stressful. She will be greatly missed." CTC instructional paraprofessional Kim Steinley also complimented Gloria's work ethic, saying, "Gloria is one of the most dedicated and hardworking people I know. She goes above and beyond her duties. Gloria cares about people, and she is one of the kindest souls I have ever known. She engages with everyone in a kind manner, including the students. No matter how busy or overwhelmed she is, she takes time for everyone. Gloria, you will be sorely missed." The board thanks Gloria for her service and wishes her the best in her retirement. And if I misspoke, she's retiring on January 29th of 2021. So thank you, Ms. Samsel.
Okay, thank you, Dr. Baker. At this time, we're going to move on to the superintendent's update. So I'm going to turn it over to Dr. O'Donnell.
Thanks, Amber. I have one communication, well, two technically for one of our programs regarding our extracurriculars this fall. We have a team, the cross-country teams, that I'd like to recognize. I'd like to congratulate our high school girls cross-country team, which turned in a stellar performance at the state meet in Hershey last Saturday. For a second year in a row, our girls team placed second in the state, bringing home silver medals. Leading our team was senior Jordan Reed, who placed ninth in the state with a time of 19 minutes, 42 seconds. The other team members who competed were Carson Kane, Marley Kwasnika, Vivian Scott, Amy Devon, Grace Morningstar, and Maggie Leahy. Congratulations to the girls team. Pretty impressive. I'd also like to share kudos to Brady Bigger, who had an incredible cross-country season. Brady, a member of our boys team, won the District 6 championship, the Mid-Penn championship, and then went on to win the entire state individual championship. He's the first state high boy to win a state championship since 1977. Brady blazed the time of 16 minutes and 7 seconds in the race, and we'd like to congratulate Brady. And I'll be checking in with him over at the high school sometime soon. I'd also like to congratulate our boys team for their 5th place finish in the state. The other members who competed are Trent Dinant, Sean Adams, Benton Norton, Nick Sloth, Charles Andres, and Jacob Messner. So congratulations to both teams and coaching staffs on a wonderful season under some pretty unique circumstances. So with that, I'm going to shift over to the superintendent update. We did attach a document with quite a bit of detail that we shared with our school community on Friday. Our intent is to share our thinking and what we're grappling with. Obviously, we're at a different place than where we were in the summer or even a month ago. You know, our team that helped share thinking from the community with their expertise includes several physicians and epidemiologists who, I just want to say, sacrifice so much of their time to help us. And although we have formal meetings twice a week, there are several meetings that are occurring on weekends and outside of our planned times because we want to run things by them that weren't in any playbook or handbook. And I just want to thank them before we get started tonight. They joined us tonight because, again, we want to share some information with the board and the community. And once we share our update, we'll open it up to board members for questions. I know we have a meeting midday tomorrow as we continue to monitor our situation and look toward next week and beyond. So our current status at this point, we believe we are safe to be in schools, and we have our team here to explain from their perspective what they're seeing and what they're thinking. To date, we don't have any evidence to suggest any transmissions of the virus during the school day within our schools. We do, however, know that we are struggling with staffing in some of our schools. That is, we now have 34 employees who are out for approximately 2 weeks due to quarantine or isolation requirements. This does not include our employees who are out for other reasons, including illness. Thus, this is a serious problem that we're grappling with, and I can't thank our principals and staff for coming up with solutions on a daily basis that are less than ideal, but we are doing it for the number one reason why we're here and serving our community, and that's to serve our students. As you know, we're struggling to have enough substitutes on a regular basis, and this year's been a little more difficult than before because of the increased need. I want to also thank our families for their diligence in reporting COVID positive cases to our nurses. We rely on these reports, and I want to encourage this to continue. This allows for us to complete timely contact tracing and to mitigate spread within our schools. I'd also like to thank our nurses for the countless hours they are spending on contact tracing. In many cases, this takes our nurses several hours to complete this process for one individual case. They are exhaustive in their approach to identifying close contacts, and Jean Knaus is with us tonight, and she's going to share a little bit more regarding this process. I'd like to now share a few key reflections and some detail regarding the positive cases in our district. Since August 26th, we've had 24 students who have tested positive. 19 of the 24 students were not in school with symptoms or when they became positive, and contact tracing showed that. And that's a testament to our families. They're doing the right thing as soon as they know, and also to our nurses, because they're partnering with parents and answering questions, as well as sending students home who are symptomatic or when a family member becomes symptomatic. 8 of our 24 cases were in quarantine when symptoms started or the student tested positive. 7 of those 24 students were already fully remote students and had never been in our buildings. 4 were not in school within 2 days of the onset of symptoms due to in-service timing or a weekend. So that leaves 5 students to date were in school within 2 days of onset of symptoms. None of those 5 had close contacts. I'm shifting gears to employee cases. We've had 17 employee cases to date since August 26th. 6 of the 17 were not in school with symptoms or when they tested positive. Of the 11 who were in school within 48 hours of testing positive, contact tracing identified that 6 of those individuals did have close contacts within the school with other colleagues during or after the school day. None of those close contacts were students. And then finally, regarding our employees, employee random testing, of 217 tests, we have had 1 employee who's tested positive. I don't think I need to have that. Okay. So I'm gonna move on to the contact tracing information and ask Jean Knaus, who heads up our nursing team and student services, and she's going to share a little bit about contact tracing, and then we're going to move into some points that we're going to ask of our safety team members that joined us to share. So, Jean.
Sure, thanks, Bob. First of all, I'm not a nurse, but I do think I could be a contact tracer at this point in time. Just to be clear, our district follows the contact tracing is 48 hours following the symptoms, the onset of symptoms. They contact trace for 15 minutes, and they use a 15-minute threshold cumulative over that 48 hours and 6-foot window. So the 6-foot buffer around the student. So they follow those 2 things and go through every part of the student's day or the staff member's day to identify who the close contacts are. When they're sending kids home, they use the 2-group symptoms checklist. And so group A is one of the following, which is a cough, shortness of breath, difficult breathing, lack of smell, lack of taste. You just need one of those symptoms. The group 2, the group B, you have 2 symptoms, and they are fever, nausea or vomiting, chills, fever with chills, muscle aches and pains, sore throat, diarrhea, fatigue, congestion or runny nose, and headache. So if a student just has a headache, they aren't sent home, and they aren't considered to be someone who is a person under investigation. They must have 2 in that list. And so that's how they run our system. I think I just glanced at a couple of our schools. I think the high school to date has sent over 300 kids home. So we're really doing our diligence with that. Our staff are very aware of that. Our nurses are constantly looking at these kids and sending them home and communicating with families and sharing the letter that goes home with them, explaining what they need to do to move forward. So they're really, really taking this very seriously and staying on top of this.
Thanks, Jean.
Sure.
At this time, I'm going to ask some of our safety team members from the community who've joined us to share their thinking regarding, why do you think it's safe for students and employees in our schools at this time with what you know? And with us this evening, we have 2 epidemiologists and 2 physicians. From Geisinger, we have Dr. Dross, and from Mountain and eHealth, we have Dr. Huggins. The epidemiologists with us tonight are Dr. Bonney and Dr. Ferrari. So they've all met with us before publicly. And so I wanted to have them weigh in and share from their perspective some of their thoughts. And then we'll move to a couple more questions before we open it up to questions. So would anybody like to go, or do you want me to start picking on people? This weekend when we were doing sharing some contact tracing and asking for some feedback while we were analyzing the information, Matt had shared some things that I thought were important, just because these people are seeing contact tracing in different environments. And so Matt, I don't know if you'd want to reflect on some of the things you shared from the weekend.
Sure, happy to. And so thanks everybody for coming and listening, and really actually just I think the engagement that we're seeing here with all of our families, I think is part of why we are feeling confident and why we feel like we are seeing a lot of success with the contact tracing process. Again, just to sort of back up, I want to just reiterate the whole purpose of contact tracing is so that we can target quarantine only to those individuals that have been in close contact, rather than having to subject whole classrooms or whole buildings or the district as a whole to quarantine. So, to be confident that that we're detecting these contacts quickly, and getting these, and removing these risks from our school, we actually look at some of the numbers. Not only do we talk to the nurses that are doing this, and we get the stories and the backgrounds on these, and we get to hear that families have been compliant, they've been forthcoming with information, all of those things. Just hearing that process is going smoothly gives us confidence that they're getting the information necessary. So we've actually been reviewing many of those cases, and comparing that to some of the other cases that I've seen around the world, and even on the Penn State campus, right, where the concerns are that they're running into lots of barriers, not getting the information necessary. We oftentimes hear a lot of frustration in contact tracing, and within the district, we've generally speaking been hearing that this is going smoothly. And so that's qualitative, but I think we also have some real quantitative metrics that are giving us confidence in this. And Bob went through this, right? But to hear that only 5 out of 24 student cases were in school, even within 48 hours prior to their positive, and so their positive test or their symptom onset, and so only 5 of them even could have possibly had close contacts in the school, right? That's actually really, that's, I think, a real testament to the fact that most students were being asked to quarantine quite early in the process, getting them out, and we were discovering them as positives or symptomatic only after the quarantine process, right? And really, that's the ideal that we're looking for here. In a perfect world setting, the only positive tests we would get would be those that were already in quarantine. And, I think asking for a perfect world is well beyond what we can expect of 2020, but I think we're getting really close to that with with seeing that the cases that we're seeing turning up are actually already after we've started that process of removing the risk.
Thanks, Matt. Does anybody else want to share? Allison or Joy?
I mean, I'd just like to point out that our mitigation strategies are working. We haven't seen any transmission within schools, which is a huge deal. And I think that SCASD has gone above and beyond the recommendations for mitigation strategies in schools based on, classroom spacing, transportation plans, those types of things. I mean, we know that masks, physical distancing, and hand washing work. So I think, just continuing with this plan and, that's what I would do.
Thanks. Joy?
And Joy, do you want to add to that, or do you want me to go to the state level summary? So I'll just add to Allison's comments that, we were worried in September that case numbers in the county essentially would be too high for us to be able to mitigate successfully in the school system. And in late September, when we reopened, we found that half that level, which is kind of where we got to, was a number of introductions or a number of potential cases that we were able to mitigate inside the school system. So we're just at this level where, as you've heard, there are individual cases that are identified. The mitigation efforts do work. A lot or all cases are contact traced, and we don't see any outbreaks inside the schools. And just to give everybody a picture of how well we've been doing inside the schools, our rate of infection through all of September and all of October was 5 times lower than the state's rate of infection, so Pennsylvania-wide. So that means we're doing 80% better than the average county or the average locale in Pennsylvania, where cases have been counted on a daily basis through the Department of Health.
Thanks, Maciek. Another question for the group. what, if anything, causes you concern as we look at the post-Thanksgiving holiday timeframe and forward?
I'll take this one. Sorry, I didn't unmute myself before, but thanks for jumping in there, Maciek. I think it's really important to note that we're all a little nervous as cases go up in the community and we see more and more community spread. I think a lot of us have concern about the ability to be able to keep schools open and keep the community open and that sort of thing. Certainly right now, without a full economic shutdown, we feel pretty strongly that kids are safer in school for those statistics that Maciek just mentioned. The incidence rate in the school population is much lower than the community as a whole. And I think that's because of the mitigation strategies that are in place. If there's any weak link in that system, I would say the hardest things for people to follow through on are truly staying home when they're sick. Symptoms for this illness, especially in kids, are going to start really mild. So the nurses have been great about sending people home, even with mild symptoms, and that's fine. I know sometimes it's frustrating for families. Families are coming into the office to get tests, and there are times when that's frustrating. But we're trying to get a handle on a pandemic, and the way we do that is to make sure we're not sending kids back into the school environment with mild cold symptoms that end up being COVID that they could transmit to their classmates. And that goes for teachers and staff too. Everyone is committed to their job and those responsibilities, but this is the time that if you're sick, we want you to stay home and we want people to follow the quarantine guidelines. If one of your family members is getting tested, we appreciate the times that people pull their other students out, or if you've been identified from something in the community as a close contact and you should be under quarantine, then fulfilling all 14 days of that quarantine are really, really important. The Thanksgiving holiday coming up makes us all nervous. I know everyone is tired. Everyone really has COVID fatigue, and I get it. We all live it. And we miss our families. People had to adjust vacation plans and time to see family members and that sort of thing. We're at 8 full months of this at this point. And the holidays are a time we want to be together, but bringing together 4 or 5 sets of families, all from different geographic locations, into a close contact environment is worrisome for transmission of the illness. And I think we're finding more data that eating together, obviously that's a time that people have to be unmasked, and most of us when we sit at a table are not 6 feet apart from the other people that we're eating with, and I think that's a pretty high risk time. So we really want people to be cautious around the holidays, cautious about travel, consider quarantining if you do travel. It's just, nationwide we're seeing numbers go up. And I know it's because people are tired, and I know we're moving events inside, but I think now is when we have to be more cautious than ever.
Thanks, Joyce.
Thank you.
Does anybody else want to weigh in on that question looking forward? Well, actually, I'll move on to the question. What do you foresee moving forward into December and beyond?
So I'll just to follow up on that question and to follow up on Joy's. So again, part of the reason that SCASD has been relatively successful is because we've been able to stay on top of things, and we've been able to we've had the resources and the personnel to follow up on contact tracing and to restaff classrooms when staff and teachers have to quarantine themselves. Any significant increase in the number of cases that are out there means more and greater demands on the contact tracing process and greater demands on staffing due to absenteeism. So even if the illness component of this doesn't become overwhelming, just simply the operational component of this can become a real challenge. And so this is, again, this is running into those operational limits is, I think, a real concern going forward. The team is already quite quite strapped and working really, really, really hard to keep things safe at this point. So again, this is, part of our concern. It's also part of our ask to the community to be, to be as safe and preventative as possible over the Thanksgiving holiday and through the coming weeks, because trends are increasing. They're increasing throughout most of the country, and I don't think, we're trying really hard. We've been outperforming the state so far, but things will catch up with us eventually, and we're really, we're trying to value every day that we've got to keep our kids, to keep our kids in the classroom.
Yeah, and I'll just add about concerns that we're looking at over the next 4 to 6 weeks. As everyone knows, we're in this third wave, and that it's bigger than the summer wave or the April wave that we saw. It's another time that we're going to be looking to the state, to the Department of Health or the governor for guidance. That may mean that there will be lockdowns or more business closures. We, of course, don't know that ahead of time. But it is something that's going to help us determine whether schools should remain open, or with other businesses, schools should remain closed. Maybe they'll be required to. The one situation that we've been discussing at our safety team meetings is, what do we do if the situation arises that cases do begin to increase steeply, but we do not have guidance from the governor or the Department of Health as to whether we should shut down. So this is probably our biggest speed bump coming up in the next 2 to 4 weeks, and it's something that we discuss regularly at these meetings.
Thanks, Maciek. Before we turn over to board members for questions, I think when we talk about closure, whether it's individual schools or district-wide, obviously transmissions in schools is something we've spoken to here, and we do analyze that pretty closely. And there's a chance that we could come across that, because we are humans, and sometimes the 6 feet or decisions people make cause exposures, and we want to make sure we address and respond to them effectively and as quickly as possible. So transmissions is top on the things that we're analyzing and looking for in the district. We have a critical number of cases in one building is also another factor where that would cause us to make a decision to close a school. Our considerations would include the location of cases and the connections between them, time and space, as Gene always tells me. We can't adequately staff our buildings and operations. As I said earlier, we're struggling with that now. And I just want to be upfront with everybody, because that's a real challenge for us. If we continue to have close contacts, not even cases among our staff, but because of what they experience with their families, that could cause a negative impact on our ability to stay open. The local hospital status necessitates our closing. We ask them about, are they seeing a relationship between us being open and what the patients they're treating, and they're not seeing that relationship from us being open and what they're seeing. As well as, obviously, as Maciek mentioned, we could see something coming at us requiring such as what happened in the spring. So I just wanted to reflect on those, and we'll continue to look at all the different variables we have, and things are changing. We know a lot more now than we did in the summer, and we continue to collaborate around each of the cases we have and what we learned from the contact tracing with nurses, and also with our employees, our HR departments supporting us and keep it on top of that as well. So at this point, Amber, I think we should open it up to board members for any questions they have of the team members that are here with us.
Sounds good. Thank you, everyone, for being here with us this evening. Okay, board members, questions? Gretchen.
Yeah, thanks. I had a couple of questions. And I guess this one is for Bob. But I'm just curious, you said, Bob, that there's creative solutions that are happening right now for staffing. And I was curious what those might be.
Yeah,
That was my question.
So if teachers are quarantined, they're still teaching. They're teaching remotely, and when students come in, so we're not always so we have a certified faculty member, but we will use other staff to cover the classrooms. If we need direct instruction, in some cases, we're closing down some of our services, such as title services, if we have to, if we don't have a certified teacher. We can also, since in quarantine cases, use paraprofessionals and other support staff members to make sure that we don't have classrooms unsupervised. In the secondary schools, I understand we have some faculty where, since we do have early release in the high school, some of the duty periods for faculty are coverage periods. So rather than having people miss their planning time, which does happen, but we're trying to avoid that. And so those duty periods are being assigned for coverage, but we're also, in some instances, having multiple classrooms of kids. So if a math teacher's out, but we don't have someone to supervise a classroom, we may join them with a couple other classes in a large space, such as the cafeteria, if it's a non-lunch period, because we can be very spread out throughout the cafeteria and not need multiple staff. So those are just some examples, Gretchen.
Okay. Yeah, thank you. I was curious about that. And it sounds like sometimes some of the creative solutions would mean that a staff or faculty member would be covering different rooms so that they would then potentially, I'm just thinking about contacts in terms of how many people are they around. And I know ideally, like you'd have in an elementary classroom, that teacher would be with just those kids in that room. But when there's staffing issues, it sounds like sometimes that might have to increase. Is that correct?
Yeah, that's correct. So if it's my duty period and I'm asked to cover one additional class in the secondary world, because of the AB cohort, it just depends how many students are present that day. So you could have, up to eight kids, 10 kids max that you'd be responsible for.
Okay, thank you. And then I have one other question, and I think this would be for either Matt or Maciek. So I'm just wondering if a whole class is asked to quarantine, but a sibling of one of the students who is quarantining is not asked to quarantine. So that student, the sibling, is allowed to go to school. Does that defeat the purpose of the student quarantining who's doing that, since they live together?
That's a great question, but no, it doesn't. So the sibling would be the contact of a contact. The purpose of getting the students into quarantine is because we think that they've been exposed, and we don't yet know if they're infected or infectious or not, right? So they're clearly higher risk, but we don't yet know. If that student were to develop symptoms, then the sibling and everybody in the home would then become a close contact, and then they would be asked to quarantine from that point forward, right? But again, the quarantine process is necessarily sensitive, and it's proactive, and so the hope, as we said, is that most of the people, again, it's sometimes hard to even for me to wrap my head around it, but we're really hoping that the people that we put into quarantine, most of them aren't going to ever be infected, right? That's what you're going for, right? And so again, until we have evidence that any of them are, then there's no reason to have that knock-on effect to other individuals in the household.
Okay, thank you, Matt. Thank you, Bob.
Gretchen, I didn't finish my own thought. It depends. It could be more than the number I said if they're asked to cover multiple classes in a larger space. So I just wanted to make sure I didn't miss a key point. So they could have more kids that they're responsible for during that coverage. Sorry.
Okay, thanks.
Laurel?
Yeah, thank you, Amber. And thank you all for being here to answer our questions. One question was the random testing that you had mentioned, Bob, that sounds like it's gone fairly well. If someone shows up and actually does, when questions seem symptomatic, do they still get random tested or do we shift them to somewhere else?
So if someone's symptomatic, we would send them to be tested right away. We wouldn't send them into the random testing process. I believe, Linda, I don't think we've had that situation yet.
No, we have not. But if somebody showed up to work symptomatic, we would tell them to go home and contact their doctor and get tested. So they would do the testing on their own. They would select the site they wanted to select.
Okay. So the random is the one that we had approved the contract that you just tap employees at random. They go, they have tested, and we've only had one that's come back out of like 270, you said? So out of a fairly.
So, right. And he was asymptomatic. He had no clue.
Yeah. And one of my questions when we talked about the in-school, which does sound very good, but some of these kids then, especially the children, but also the adults, if they're contracting it outside of school, but from people they know in school, how do you, like, maybe a second grader and a fifth grader, just to pick an example, because they're not in the same classroom, so they wouldn't show up necessarily with contact tracing, but would it pick up if they had spent time together outside of school?
Yes, they go through those questions. Well,
okay. You don't just ask about during the school day questions.
Right. They'll even process what they should do and isolate and quarantine and other family members and notifying them. We only do internal as far as communicating so that we can say who it's impacted, but the nurses go over everything.
Okay. So it could be that they're getting it outside of school from people they know from school, but it's not, as best you can tell, not happening because the things have been violated, or even, and that I think is a question I have for the medical people is this the level you would expect, assuming we're doing everything right? I mean, we put these fairly stringent protocols in, but they might, that not necessarily 100%, but does this fall in line with your feeling, yes, what we're doing is working?
Yeah, I'll start with the comment on if it's connected in school. We've had to date no transmission in school detected. So nothing has been connected at all by cases. So that may change, but right now that's where we are.
And that's true for employees as well.
It's been a parent who's been positive or a sibling who's been positive. It has not been a friend in the school.
So Laura, your question was about contact tracing, and do the medical professionals, epidemiologists, do they believe we're doing effective job with that? And they do.
No, with the protocols. In other words, do they think that I'm thinking I know the answer. I just wanted to hear it from them, that what we are doing, the various things, the masking and the distance is that they would expect to see no transmission if we're doing these things, or virtually no, very low or none. Is that
right? Right. I think it's a really good reinforcement as we've done. And I can't say enough about the job that the nurses are doing about being thorough and thoughtful with contact tracing compared to my experiences with perhaps patients or other people I've heard from outside of our district where they're relying completely on the Department of Health. Those contact tracing phone calls come at the end of a person's quarantine period. I mean, our nurses are really doing a tremendous job. I know it's taking a lot of effort, but they are on top of this within 24 hours of hearing about a positive test, because families have been good about sharing that information and tracking down those contacts. And so I think we do feel quite good about not seeing any transmission in the school environment. And then, to reiterate Maciek's point that the incidence of coronavirus in the SCASD population, students and staff, is 0.5%, whereas in Pennsylvania as a whole, it's 2.5%.
Yeah.
So I think that's really good and reassuring as well. It's good enforcement that we're doing the right thing. We have to stay really diligent. And heading into the winter, as we'll see more cold symptoms, we have to stay really, really disciplined about staying home when you have symptoms.
Okay. And one is following up on what Gretchen had asked, which was in terms of where the staff is coming from. When you've said, we've had to be creative and all, what about then those programs that the people are getting pulled from? What happens to those programs then? Because, we don't have non-essential programs.
Some interventions are put on hold and don't happen that day. If we are pulling someone who's an interventionist, if we're pulling an instructional coach who had a plan to either co-teach or help a particular teacher with something, then those things get postponed and don't happen that day.
Okay. Thanks. I may have something later, but that's plenty for now.
Vern, is there anything I missed? I think it's more prevalent in K-5, Laurel.
The having to pull.
Yeah. We don't have the flexibility to bring, we have a higher percentage of students in school and we have less large spaces available to us in K-5. So we have less flexibility. So we have to cover the kids where they are in their classrooms.
Correct. Yeah.
Scott, I see your hand raised.
Yeah, thanks, Amber. I guess, so I had two questions. But first, just kudos to the administration and the safety team for all your work and diligence, but also into the thoughtfulness that you all put into this plan. Because, as Joy just mentioned, we have some of the lowest statistics in the state in an area that most predicted would be of the highest statistics in the state. So we have the lowest statistics in the state in a college town. And I think that speaks very highly to the community buying in, especially the SCASD community buying into the plan, but also just all of the effort that the safety team put in, the administration, and all of our staff carrying it out. So, I just can't say thank you all enough for all of the hard work that you're putting in on behalf of the kids and the families of the district to help keep our kids in school. So thank you very much for that. Two quick questions. Matt, you had, when you were going through your scenario with the class that was quarantined and there was a sibling, so you had a close contact and then you had a contact of a contact. And I think I heard you say that if the classmate who was originally quarantined, so the close contact, if that person developed symptoms, that then the sibling would be quarantined. And I wanted to clarify, is that quarantined and the sibling who has symptoms would then have a test? And basically the whole family would be quarantined until that test came back negative? Or is it an automatic quarantine and no test requested or required? Does that make sense?
It's a great point. And so to be explicit and technical about the language. Yeah. So if the classmate if the classmate is symptomatic and we know that and they're symptomatic and a class contact in that case, right? Then they should absolutely get tested, right? They would absolutely be a person of interest and they should get tested. If that test comes back positive, right? Now then everybody in that household, presumably, unless they sequester that child right away. And isolate that child right away, then everybody in the household would then become close contacts of now a the infected classmate. The classmate would, terminology wise, we would say the classmate would be isolating, and all the family members would be quarantining.
Okay.
Right? Yeah.
Yep. Thanks. That's clarifying and helpful. And then a quick question for Jean. So I've heard the list of symptoms, and silo A being a single symptom, silo B being multiple symptoms. Where does that come from? Because I've heard about it primarily locally, but in State College and also in other school districts, but I haven't seen that as a larger predicator for staying home or sending somebody home, whether it's school or work or whatever it is. I've seen it multiple places, but I just didn't know whether that was something that PVE put out, or that's something specific to Pennsylvania, or where we had that. And then the second part of that was, I know way back when we first did this, we said about the 15-minute window, and that at the time, if I'm not mistaken, the CDC hadn't really come out and defined that window for a close contact. And I didn't know whether that had changed and whether there was any further definition. Well, obviously the plan's working, so we're doing the right things, but I was just curious if the CDC had ever come back and kind of backed that up or anything.
Yeah, so first I'll say that is the Department of Education. I'm looking at the website right now that has the list on it, and I have the link. I can put it in a chat or send it to someone if so. It's the Department of Ed that has a 2 list. If you have any of the symptoms on either of the lists, you should stay home. These are what the nurses use in the building to educate the families on why we should get a COVID test. So in answer to your next question, and it was about CDC and the guidelines, we are greater than the guidelines. The guidelines actually say 24 hours. We've always done 48 from the onset of symptoms. So our mitigation measures are actually more stringent than what the CDC recommends. We didn't want to change it when they came out because we thought, why change a good thing? And our nurses got a good system down, and they didn't want to. They even changed a few other things the CDC did in Department of Health, and we decided, no, we're not changing it. We're not going to lighten up. And that was at the advisement of Matt and Maciek, and saying, don't go backwards at all until we get through the hardest part here. And so we did not lighten up on anything. We stayed pretty heavy throughout everything, and we want to keep it that way because it is working.
Great, thank you.
Sure.
Dan?
Yeah, thanks, Amber. Well, first I want to thank Joy and Allison and Maciek and Matt for helping us out and serving as our consultants on our safety team. That really adds so much value to the kinds of work that we're trying to do. It occurred to me in the last day or so, as other questions have come up about our role as board members. When I ran for the school board, I never thought I would serve as a representative of the Department of Health or as a public health policy representative. This is a different kind of role, and you have really provided a lot of guidance for us to be able to try to fulfill that role. I have 1 or 2 basic questions. One of them that comes to mind is with this firewall, so to speak, that we've created, it's not impervious, but we do have some infections that are kind of gradually being discovered, but we're kind of eliminating them as a source pretty quickly. If it were just us, we could have put a bubble around our own system. Would it be fair to say, and this is a question for Matt and Maciek, would it be fair to say that we could eliminate the presence of the virus if we just put a bubble around ourselves and eliminated outside sources of influence here? That's a hypothetical, I realize.
Well, maybe a bubble around SCASD only.
Yeah, right. That's what I mean.
Yeah.
Right.
Yeah. I mean, the short answer is
the rate of infection. I'm thinking the likelihood of it moving within the system would be eliminated after a while.
Yeah. I mean, if it's about SCASD only, then maybe I would guess that, yes, I think so. I think we could, with a sustained effort of multiple months of this type of contact tracing and quarantine and isolation.
Yeah.
But yeah, we just don't get to control what's out in the community. And
right.
Of course, in September and most of October, it was the undergraduates, and that's the part of the community that's the most difficult to control. So yeah, if everybody did this to this degree on the small numbers of cases that we see, then yes, we would be in excellent shape.
And I guess, and that leads me to the other question, which, and I don't want to compromise you guys in terms of your roles within the university, but I guess I'm wondering, what were the dynamics of the onset of infections within the student body, about which we, as representing the school district, were very concerned, and still are. But how is it that wave, if you will, of infection has been kind of, I wouldn't say eliminated, but the impacts have been reduced somewhat than what we originally feared?
Yeah, so it's hard to really provide a definitive answer as to why we saw a wave that seemed to have dissipated on campus. What I can say, so there are a couple of things, right? Is that there always will be some proportion of the population that tends towards very risky behavior, and some portion of the population that tends towards preventative behavior. And so one explanation would be that those that weren't really willing to take on the mitigation efforts, they fueled that initial outbreak. And really what we're now seeing is we still have transmission, we still have cases every day. It's just that it's sort of percolating through at a much slower rate. So really we had sort of two outbreaks. We had a really fast one through the non-compliant population, and we have a much slower one through the compliant population. And we haven't been able to, really stamp it out on the Penn State campus the way that we have in SCASD, because you just don't have the resources. The population is so much bigger.
Right.
So that's one hypothesis for that process. The other thing is that we did really make some immediate changes when cases really started taking off really quickly at Penn State. So within the first several weeks, we actually really ramped up testing and testing access, and that I think was that was something that I'll say that I didn't anticipate the degree to which students would comply with self-identification and self-testing. Right? Yeah. We've struggled to get them to go through UHS or through that, getting tested through our clinic on campus. But when we provided a non-clinic resource where they could just, where we opened up a testing center in one of the parking decks, and they could go, and they felt like there were fewer consequences, and they were less likely to be forced into quarantine. We would have liked them to be quarantined if they were showing up there, but at least what we did was we increased the amount of testing because of that, and we were detecting and finding more cases as a consequence of that. That then meant that all of those students were actually remarkably forthcoming with their contact tracing. It's just that they were doing it as a peer-to-peer process. They were getting a positive test and telling all of their friends. So unfortunately, a lot of that wasn't coming through our Penn State contact tracers, but it did I do think it had a meaningful effect in terms of slowing down the spread slowing down that initial spread that we had on campus. And so as soon as students became aware of those resources, then I do think that's likely to have had some mitigating effect.
And at that age, I think making it more anonymous rather than walking into a facility which is identified with illness or with someone being infected as opposed by their peers or someone they might know, as opposed to doing something on a parking deck where they're unlikely to see any of their peers out and about that might be more likely to participate. I'm just guessing. I mean, who knows? Exactly.
Yeah, I'll say that I don't think there was any stigma in terms of running into your peers or anything like that. All the students that I know on campus, and we've actually done surveys of students when they come in, they happily give up the names of the students that they interacted with, and they're happy to give it up. So they're not quite so happy to give it up to Penn State officials.
Got it.
But they're very happy, but they're very happy to give it up, to their friends and call and tell their friends, hey, I just got tested. Maybe you should go get tested. So again, So I think actually we've actually been realizing that if that's the way that we can reach out to students and we can reach out to them through peer-to-peer processes, then that's something that we should really just be trying to capitalize on, because it's maybe less effective per individual, but it reaches more, and the sum of it actually becomes more effective.
Thank you. As a community member, but outside of the system, your system, there were just a lot of questions that arose as we were wondering how these processes were taking place. Thanks for clarifying that. And again, thanks to everyone for your help with us. And thanks to the administration for your efforts to provide some high expectations for our staff in terms of complying with and following the safety plan. Obviously, it's working. Thank you.
And thanks. I wanted to follow up, and there's no question the people with the toughest job in all this are obviously the people managing the students, implementing the plan while they're trying to do their regular job, and that's at the classroom level. So, without our faculty making this happen, we wouldn't be in school. And I don't know if any of us expected to still be in school at this time, and to be able to look at all these cases and have a sense of we're safe in buildings because of what we know, and there's a lot of people helping us. But I think earlier today, I believe it was Dr. Dross had mentioned some observations of here we are now, we're less concerned about the college students and more concerned about the outlying communities around us. So Joy, if you would share some of your observations. I know you and Allison are seeing this through your practices, and I think that was where you were coming from.
Yes, I think as cases have hit us here in Centre County, at least in following the numbers and Penn State numbers, we thankfully didn't see a huge amount of trickle over from the Penn State student population into the State College area. I feel like we're getting more of our cases at this point from the surrounding areas and communities. And certainly, as a Geisinger physician, they put out statistics for the Geisinger enterprise as a whole, which is centered in Danville and then a lot in the Northeast, and we're the westernmost side of that. And what I can tell you from seeing those numbers is Central Pennsylvania as a whole is in the midst of a big increase in cases. And certainly we have people from some of the surrounding areas. We see patients from other school districts that kind of encircle us, and have seen a pretty significant increase in cases in the surrounding counties. And so I think that gives me pause on two fronts. One, just the community spread puts our community as a whole at risk. And then I worry about the healthcare systems as a whole. In the spring, there were cities with the healthcare systems getting overwhelmed with illness. And as this third wave seems to be spreading to more of the center of the United States and more of the rural areas, it's finally hit some of our smaller communities, and there's less ability to move healthcare resources around. So, I don't think any of us feel like we're out of the woods of this yet. And so it's really important to stay really diligent to that.
It sounds like because our mitigation efforts are working so well in school, that the limiting factor on being able to keep schools open is really going to be how well we're able to control community spread throughout our community, so that we don't have so many cases coming into school that those requirements around quarantine sort of cripple our ability to staff our schools to keep them open. So if we can encourage our community to just use every caution. And what I think should be very empowering for people at this time is seeing how well the masking and physical distancing in school is working, and that we need to take that, into the rest of our lives as well. And that's how we can hopefully keep our schools afloat and open, with enough staffing to be able to stay open, as if we do that, throughout the community.
Yeah, I think you're right. And I think it's important to say none of us approach any of these meetings as if it's stay in school at all costs. Every week we have very in-depth conversations and investigation to make sure we're not seeing school transmission as priority number one. And two, the mitigation strategies are working, the contact tracing and quarantine are catching the people that are at high risk. All of those things, we're still talking hours and hours and hours each week. And we've learned some things along the way. You know, we're now in the third month of school, and I think the important things and pieces of data that we pick up as we go through this process, then we can apply to things moving forward and make better decisions.
It's great to hear. Thank you. I mean, I can't imagine the amount of hours you all are putting in. I just really appreciate it. Laurel?
Yeah, actually, that's sort of what I was thinking, because I was thinking between you and you know, possibly even scholarly articles that you do, and Chris Rosenblum as our sort of publicist, we really are, for people who think these things don't work, we're an excellent example of how well they can work when they work. And we should be, I'm concerned about things, but I think we should really be touting that. One of the things that does concern me, and I wonder if they'll change it, is that I still, you know, the PDE or DOH, I can't keep them straight, which it is, but their guidance still says if there's substantial transmission in the county, you should be closed, period. And we're not doing that. On the other hand, we are, as Dr. O'Donnell said, we're meeting the needs of kids. And as we're seeing, what we are doing on a physical level, at least, seems to really be working. So I think that maybe as that information gets out there, that may even lead to some changes in how the big picture is looked at. And that would be good, because I think, you know, as we're sticking with this longer, and even if there is a vaccine, it's still going to be a long time. And the more people feel, I think you get less pandemic fatigue if you know what works and what doesn't. So I certainly encourage you to share this, you know, around whenever you get a chance to. And, you know, like the others have said, there's a lot of thanks to go around, both to you guys as our experts and also to the people in the buildings who are making it happen.
You know, I think, Laurel, well, one, I don't want to, you know, get overconfident, because we're pretty much on the heels every day. But I do think some of the reasons other school districts and communities aren't able to put the same mitigation in place is, I mean, we have almost 2/3 of our parents have volunteered to drive their kids to and from school. Like that, I'm unaware of anybody having the distancing on buses. And this is probably the first year I haven't heard complaints about having so few kids on the buses. But the only reason we're able to do that is because of our parents. And right now we have some parents asking to get back on buses, and we really need parents to continue that, especially through these winter months, if we're able to have in-person learning. So there's some key factors that, you know, ingredients, I should say, that make this go, that we're pretty fortunate. I don't know how other communities would ever get that level of, you know, ability from their families to do that.
That's good to know.
Had the facilities and all these new facilities, we were sort of lucky with the timing. If this had occurred a year or two earlier and we were in the middle of building projects, it would be a different situation. But so fortunate to have these buildings that are new and, you know, generously sized. Jim?
Thanks. And I'd really like to say to the safety team, you know, all of our personnel that are included on the safety team, thank you so much. I know that you're putting in a lot of hours that are, you know, some that were unplanned to enable the administration to make the best decisions possible. Thank you for being flexible on our plan in terms of allowing it to adapt and recommending changes for it as we went along in terms of, you know, what we learned as we learned more about the virus, as we learned more about transmission, and certainly as we learn more about the, you know, coupling factor between the Penn State community and the State College community. So appreciate that. And then the only question, in terms of a coupling factor, I have a question that might pertains to me, and it pertains to, I think, quite a few people in our school district. I have a Penn State student who will be home as of this weekend. What kind of recommendations would you make for dealing with that situation? I have children in the school district, and I have somebody that's coming. Now, I will tell you that they already got their, I don't know what they're calling it, the exit test or whatever, but what advice can you give for parents that are in that same situation?
Yeah. So I think so. First and foremost, the value of that exit test, decreases with every day afterwards, right? So I think first and foremost that you should talk to your student and either have them, to the extent that they can with their classes, come home right away after that. So that they were negative on that day. That's good, and really encourage them to extract themselves from any risky settings. It's also worth noting, and again, unfortunately, testing to prove that things are safe doesn't really work. Testing is designed to detect individuals that are infected. It's not designed to prove that you're not infected, right? And so again, there's, it's the classic story that everybody says. You could get infected on your way to the testing center, right? That you're going to get tested. That there's no way that test is going to pick up that it's impossible for that test to pick up that infection. It's not a failure of the test. It's just the luck of the timing, right? So again, you recognize that your student is coming out of a risk setting and coming home, and if you've already taken on that risk if you're encouraging that student to come home, right? And far be it for me to tell families not to be together, right? It's just but that should be done. That should be done safely, and that should be done thoughtfully, right? Again, between now and Thanksgiving, we've got what, 10 days, right? I mean, having your student quarantine as much as possible, right, in that time frame, really reduce interactions so that they're unlikely to, so that they're, if they got infected on the way to the testing site, right, that 5, 6, 7 days have passed before they're really interacting with a family, and that increases the likelihood that that if they develop symptoms that they'll present themselves and you'll know, right? I know that when they leave that testing, they're handing out the scratch and sniff cards, and I mean, really, this is like the chicken soup of things, right? It can't hurt. We know that loss of taste and smell is a common symptom. It's particularly a common symptom among younger individuals that aren't presenting with other respiratory disease symptoms, and so encourage them to use that, right? Just do all that is possible. I think really it's that transition from campus to home that's the risky thing, right? Hopefully you can mitigate risk as much as possible when you're at home. Keep your circle tight. I mean, it's horrible that we have to be continually in a position of telling people not to do the things that they know will make them happy, like seeing family and enjoying things, right? But even this year, being able to share a family dinner with 4 or 5 people is pretty special. And so, I try and enjoy that rather than 15 or 20 people. Again, like I said, I think that, one of the most, one of the most important traits to being an epidemiologist is, and I think Allison and Joy have agreed with me that it's also an important trait of being a pediatrician, is not being afraid to repeat yourself, right? I know the things that I'm saying are the things that everybody's been saying from day one. It's really just a matter of trying to reinforce these things. We know the kinds of behaviors that can be effective here. It's, we're just trying to reinforce everybody to stay on top of that and not lose sight of those behaviors.
Thanks.
Good reminders. Other board member questions? All right. Well, thank you so much, everyone. Really, really appreciate all your time this evening and over the past weeks. looking at this information and the level of detail that you have. Really grateful. I think our whole community is. Dr. O'Donnell, so I turn it back over to you.
We'll see those folks tomorrow. Obviously, they're not responsible for our staffing woes, and we work with those at the district level, and then obviously the principals run point at the schools, and I didn't share that because we're in a good spot. We're struggling, so we'll keep tabs, and if any status changes, whether it's any schools or the district, we'll let everybody know immediately. So I just thank the team for my request for them to come on tonight and just share some thinking publicly, and what we communicated in writing on Friday. We're trying to speak to the elephant in the room, everything we're talking about and why, and what the thinking is. And so I thought this was helpful for them to come tonight and have a dialogue with the board. So I appreciate you putting that in. I know we have a bunch more things to accomplish tonight. So to the safety team folks, have a good night. We'll see you tomorrow midday.
Thank you. Okay. Board members, any communication items on your part? Okay. Then David and Lori, do you have a legislative update?
Sure. Thank you, Amber. So several things here. First of all, the legislature is in an unusual after-election session. The reason for that, of course, is because they still have to pass a budget. We only have a 6-month budget, which expires at the end of December. The most likely result is that they'll probably pass a 2-month extension with anticipation that there will be federal money that will come in January or February, because otherwise the state is looking at about a $6 billion shortfall. And that would be pretty catastrophic. So that's what's going on there. There are a couple of other things that we should know about legislation that's been percolating, one of which is that would, Senate Bill 1216 would delay state graduation requirements. And this is something that's interested many under the present circumstances, how we could possibly have Keystone exams and which would, of course, would be part of the state graduation requirements presently. So there's a hope that that will get postponed at least for another year. And as far as I'm concerned, indefinitely would be even better. Another piece of legislation that affects us directly would be a complete change in the way school board elections are run. And part of it, and the intent of it, I think is pretty admirable, is to do away with partisanship. So there will be, but the issue with that is that you would no longer have school board primaries in the spring. And the consequences that you could have several dozen people that show up on the ballot for the first time in the fall. And that would be really challenging for the public to make sense out of that. The other thing is that it would greatly increase, depending on what class district you are, the number of signatures that you'd have to acquire in order to get on the ballot. So those are all things that are happening right now in the legislature. In addition to that, a week ago Saturday, we had the PSBA had the delegate assembly where we established the legislative priorities for the next year. There are no major changes to the priorities, the 4 big priorities we have. And you can find this on the website, and I can send you a link if you want to. The one other thing that I should mention is the most significant change probably to the platform itself is to item 4, the funding formula. And I'll just read a little bit of that here. In order to ensure that all students receive an equitable amount of funding proportionate to student needs and ability and inability to rely on a local tax base, the state should immediately put into place a sufficient funding mechanism to provide a quality and equitable public education for every student in the Commonwealth. And that's a substantial departure from what our language was previous to this. And then the final thing I probably should mention is we've been asked to contact our legislatures. One of the issues from, as everyone here knows, in terms of our finances, the amount of money that's going out the door to cyber charter schools because of people for obvious reasons, and the impact that has on us financially. And so to make sure that our legislators understand what that impact actually is. I think I got it all.
Great, thank you. Lori, did you have anything to add?
No, that's it. That's all. Thanks.
Sounds good. David, maybe we should try and keep track of the legislation about school board elections to understand what the,
I will, yes, I will. I'll keep my
that's
ear.
it. Yeah, maybe understand what it's attached to.
The issue, of course, with that is that everything expires at the end of the year. So if it doesn't get traction between now and the end of December, it'll probably get resubmitted in January. And hopefully that will happen so we can address it when that comes back up.
Thank you. Okay, Gretchen, do you have a COG update?
I do not. They have not met since our last meeting.
Okay. Laurel, you had a question? Oh, okay, your hand was up. Okay, then moving on now to routine approvals. If we could have a motion at this time to approve the routine approval listing as presented on the agenda. Okay, that was moved and seconded. Any questions on the routine approval items? Okay, is there any public comment on routine approvals since we didn't have public comment at the beginning? I'm assuming people who have their hands raised now weren't particularly looking to comment on routine approval items. Okay, I think we'll go ahead and have a roll call vote then.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazzard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader.
Yes.
Okay, that has passed. Then moving on to action items. Item A is a motion to approve amendments to the 2020-2021 academic calendar as shown in attachment 5A.
Lazard, so moved.
Leah's second.
Okay, that's been moved and seconded. Any questions or discussion on this item? Laurel?
Yeah, this is one that has been very challenging for me because I think it's one of these that is very dependent on people's individual circumstances, and we're trying to do something for everybody. But in particular, it concerns me that we didn't ask our instructional staff about either the option of eliminating the break entirely or keeping it entirely. And the couple of contacts that we've had from the board, emails and such, that have gone to the whole board have indicated teachers saying that they really welcomed that long break. And I've been thinking about it and thinking that, you know, I understand the desire to limit travel, but for some people, it's just being able to complete a project around the house that gives them a sense of satisfaction and all. I kind of feel like we have to go ahead and let people know what's going on, but I had anticipated getting more input on that. And so it was disappointing not to have it.
I had shared why we didn't include it, and that was really to discourage travel. Also, the reason we have a spring break really relates to our largest employer and what happens with attendance around that. So, but the main reason was we didn't put it out there as an option because when it came forward with the travel piece. So, you know, if people disagree with that, obviously I'll respect it and we'll move on. You know, we did it. We did put more breaks in, but when we went through the analysis of it, the committee recommendation was the second recommendation, and we wanted to keep that on the book. So we put what they suggested in, and then put a little bit more breaks in and a little less breaks in. But we didn't obviously put the two that you suggested in.
Lori?
I just had a quick question about whether or not, since the vote and this has come up now to be passed, if there's been anything from the teachers at all, if the teachers union has said anything, if they seem on the whole supportive.
I mean, it's mixed, you know, and the association hasn't taken a position as a whole and said, we recommend this or that. I mean, obviously they had members of the association, including the current presidents on the calendar committee. So they had a voice in the recommendation that came forward. That doesn't mean those individuals said that was their personal pick. I'm not saying that, but the voice at the committee table does have several faculty members, including the past president and current president of the Teachers Association that sit on that team.
Thanks.
Any other board member questions or discussion here? Okay. All right, I see a hand raised for public comment. John Wallace, did you want to make a public comment on the calendar matter?
I did.
Okay, if you could just introduce yourself and where you reside in the district, and then you'll have 2 minutes.
Hi, John Wallace. I live in Patton Township, and I have 2 children at Park Forest Elementary. And I just want to say that I'm really, really frustrated with how this was presented and messaged to parents. Basically, we got an email that said, we're taking your spring break away, and we've given these 3 options with no spring break. And this is how it's going to be. It's been presented basically as fait accompli. And I understand the desire to limit travel and to minimize risk taking, but that seems really paternalistic and, not really fair to the parents. We've put up with a lot of change this fall, and it's really, really frustrating. I really would like you guys to take a look and examine more options rather than just saying this is the way it's going to be. Like you guys to go back to the drawing board and take a look at also aligning with the Penn State calendar. If you're going to say we're doing this because Penn State canceled their spring break, then add in the wellness days that Penn State has added. I don't see how canceling spring break and adding 3 long weekends is actually going to discourage travel. Thank you.
Okay, thank you for your comments. Ari Giros, I saw your hand raised. Ari, did you want to speak about the spring break decision? Okay, I see. Are you on, Ari?
I am on. Yeah, I would love to, absolutely.
Okay, so you have, if you could introduce yourself, and then you have 2 minutes.
Okay. Hey, I'm Ari from Harris Township in Boalsburg, and I am a 13th year.
Oh, Ari, we lost your audio. Okay, we seem to have lost you. I'll move on to Kimmy Waite. Kimmy, if you would like to unmute yourself and introduce yourself, and then you will have 2 minutes to speak.
Hi, my name is Kimmy Waite. I live in Lamont. I have 3 children, 3 boys in the high school, and I also work for the school district. I'm going to try to make this short and sweet. As I stated in my letter to the board and to the State College Area School District administrators, I feel that the decision to remove our spring break a quarter of the way through the school year is inconsiderate and offensive. I believe that this decision will not stop anyone from traveling, and it implies that the adults, employees, and parents in our school community are not capable of making appropriate and safe decisions. My family is one that will not be available to attend school March 8th through 12th, while I also will not be able to work that week. We've already made plans. Please consider how you will accommodate these families before you vote. And I really liked what I believe John said earlier, that maybe there needs to be a little bit more discussion and maybe going back to the drawing board about this. Our children will not be available for online learning those days either, and we don't want them to fall behind, so especially when it's through no fault of their own. Thank you.
Okay, thank you for your comments. Martin Wildy, I see your hand raised. If you would like to unmute yourself and introduce yourself, and then you'll have 2 minutes to speak.
Hi, everybody. Martin Wildy here. I don't know if you can hear me okay.
I can hear you. Thank you.
Okay, perfect. So I have 2 kids in Easterly Parkway in 3rd and 5th grade. And this comment has nothing to do with spring break. Actually, just more regards to the safety protocol, and just wanted to weigh in. My kids have been going through kind of the in-person learning, which we originally signed up for because of the safety protocol that was in place at the beginning of the semester, which seemed very reasonable to us. As the cases expand and as we approach what seems to be the peak of this pandemic, I just wanted to share that I'm hearing from a lot of teachers that we know in the community that they're very concerned. My daughter's in 3rd grade. She's on the verge of having her 3rd full-time teacher in 3 months. I would say that it feels like as community cases grow and as the health system is becoming more fully capacity constrained, that we're starting to play chicken with this virus. And I really am getting concerned as a parent that it's, but we're measuring things. I'm glad there's been no community spread within the school district, but I'm also concerned that that's a lagging indicator. And I just want to make sure that the board is being very proactive in terms of being responsible. And I'm getting more and more nervous with what we're seeing in the community and how it translates into the school.
Thank you for your comment. I see Kimberly Falk's hand raised, and just a reminder, this is time for commenting in regard to the calendar action item, in regard to amendments to the calendar.
Hi, my name is Kimberly Don Falk. I'm a paraprofessional at Park Forest Middle School, and I guess my concern is more about the safety protocols too.
Okay, we will have time at the end of the meeting for public comment on any items that people are interested in discussing. Okay, thank you. Okay, any other comments on the calendar? Laurel, I see your hand raised.
Yeah, thank you. I just wanted to check, I guess with Dr. O'Donnell, about if there are students who do miss class during spring break. We talked about staff getting accommodations if they have made plans already that you would work with them. What would the situation be for students?
I think we would look as if it was a family trip. We'll see what the circumstances are, and obviously, if we have school those 3 days, there'll be some missed work but we would accommodate those. They wouldn't be penalized.
Okay. Yeah, I just wanted to make sure that we had that in place, because it is, for people who have already made the plans. So thanks.
Wouldn't be perfect, but I think because with it, for the older students and I've developed, our online tools and Canvas it's a little more accessible. But with that said, that some direct instruction would be missed during 3 days.
Yeah. Thanks.
Thank you. Okay, we'll move on to a roll call vote then.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazzard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell.
Yes.
Okay, so that item has passed. Moving on to item B, that is a motion to approve Ignite Educational Services contract to provide required title services for non-public schools, and this is shown in attachment 5B.
Leah, so moved.
Duffy, second.
Okay, that's been moved and seconded. Any questions on this item? I did have a question, I think for Vern, in regard to how we're currently providing these services, or maybe my question's for Jonathan.
Yeah, I can talk to that. That's no problem.
Yeah.
So as a part of the Every Student Succeeds Act, we are required to provide equitable services under all of the title grants. So I work with several of the non-public schools, Our Lady of Victory, Nittany Christian, Grace Lutheran Preschool once in a while, Grace Prep High School, Friends School, and St. Joe's. And depending on the services that we provide, then we may be providing some sort of services. This is the first year that we are providing Title I services to Nittany Christian School. Last year we added Friends School, and beforehand we were only working with Our Lady of Victory. So we do our best to try to match the non-public services to what we're working on within our own schools. So Our Lady of Victory had been receiving reading intervention services from one of our Title I reading specialists. However, through the equitable consultation process that I'm working with these schools on at all times, we sometimes have different programming, so they don't have to necessarily spend their federal dollars the way that we do. And depending on their specific needs, whether it's in Title I, Title II, Title III, or Title IV, we're coming up with different ways to do that. And the one way that makes it really difficult when we're looking at staffing is having to take our own teachers to provide those services. So this agreement will help to free up the need from sending SCASD staff to do that and be able to provide more time to the SCASD kids while still fulfilling the needs that we have. And third-party contracts within federal programs is very, very common.
Okay, good to hear. Laura?
Yeah, I just wanted to reiterate that for members of the public who may be wondering why we're doing this, that this is a federal, we're required, it sort of runs through us, but they do get monies based on their needs. And I believe you actually said in there that it was revenue neutral, if I'm remembering the.
Yeah, it all depends on the different grant. Each grant has their own revenue generators and how that whole system works. But for the most part, like for example, in Title I, we still use, it's really taking the kids that would be attending Title I qualified schools and then they're in a non-public school, those kids become generators and things like that. So.
And in this district, most of them wind up in this district eventually anyway, years down the road. So I think sometimes people say, well, why are you doing that? And that's why I just really wanted to reiterate that along with being good folks, we are required to.
And it's also good to know too, that when we look at spending any sort of money on supplies or things, all of those things do become the property of the school district. So even though we're providing them to the non-public schools, they are our property. So we do regular inventory checks to make sure that all those are there.
Thank you very much.
Thank you. Any other board member questions? Okay. Any question or comment from the public? I see Martin Wilde you have your hand up again. Did you have a question or comment in regard to this services contract?
No, I'll wait until the end. That's fine.
Okay, thank you. Okay. Anything else from the board? Then we'll have a roll call vote.
Ms. Concepcion.
Yes.
Dr. Duffy.
Yes.
Mr. Fazzard.
Yes.
Mr. Hutchinson.
Yes.
Mr. Leos.
Yes.
Ms. Sidney.
Yes.
Dr. Vader.
Yes.
Ms. Bedell.
Yes.
Ms. Brandt.
Yes.
Okay, so that item has passed. Item C under action is a motion to approve Memorial Field change orders. This is shown in attachment 5C.
Bedell, so moved.
Duffy, second.
Okay, that's been moved and seconded. Any questions or discussion from board members? Okay, any public comment on the change orders? Okay, we'll have a roll call vote then.
Dr. Duffy.
Yes.
Mr. Fazzard.
Yes.
Mr. Hutchinson.
Yes.
Mr. Leos,
Yes.
Ms. Sydney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion.
Yes. Okay, that item has passed. Item D is a motion to approve the 2019-2020 audited financial statements, management discussion and analysis, and this is shown in attachment 5D.
Duffy, so moved.
Okay, that's been moved and seconded. Any questions or discussion on this item? Yeah, this was reviewed in the Finance Committee last week as well. Okay, any public comment on, oops, I'm sorry, Jim?
Yeah, no, I just want to say that I think Randy and his team did a fine job. They reviewed it in the Finance and Audit Committee last week. And I think in particular, the way they addressed the, ongoing costs and from COVID was good. So thank you for that. And thank you, Donna and the team for that.
Thanks. Okay, any public comment on this item? Okay, we'll have a roll call vote then.
Mr. Fazzard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sydney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy.
Yes.
Okay, so that item has passed. Moving on now to the information discussion portion of the agenda. Item A is under category safety. We'll be looking at a health and safety plan update. This is shown in attachment 6A.
Okay, I'll get started with that. So there are a few things when reviewing the plan that we wanted to make sure we brought to the attention and did some revisions on. And if you click on the link there, you can follow along with me on the plan and the actual updates. First specifically is on page 15, which we added the word temperature to the wording, and I'll actually pass it over to Ed Paulbrick right now to talk a little bit about the HVAC system and what things are going to look like as it gets colder outside.
Thanks, Jean.
Sure.
As Jean mentioned, we are updating our language in the plan to reflect language and recommendations that have been updated in the CDC guidelines. And our original plan was modeled around those recommendations. And as we've entered the fall season here, the CDC has modified their recommendations around advice about opening windows. Originally, the CDC guidance said when conditions allow. The CDC has modified that to say when weather conditions allow. Our plan, based on the way it was written, we were modifying, as Jean said, to use operable windows when outdoor humidity, temperature, and allergen levels allow. Your memo does go through the actual CDC language. We will be communicating with staff, particularly through these transition months in November and December, that in many days it will still be able to open windows. On some days you may be able to partially open windows. On some days you may be able to take window opening breaks. But what we want to do is maintain acceptable temperatures within the classrooms. The way, I don't know that there's any systems anywhere that will be able to maintain acceptable indoor temperatures with wide open windows through the winter. We realize that, on a 0-degree day, there's no way you can keep windows open and have a habitable building. So we're going to work with our teachers to allow them to understand that we still want to open windows to allow fresh air, additional fresh air when possible, but to keep the also periodically close them to keep the temperatures in a reasonable temperature range. We'll also, sharing with you, as we'll share with our staff, that we have successfully made changes to all of our HVAC operating systems to maximize the volume of outside air delivered through our HVAC systems. And when you look at ASHRAE guidelines, which is the American Society of Heating, Air Conditioning, and Refrigeration Engineers, they've never recommended opening windows. Their recommendation has always been to modify your HVAC systems to create the outside air delivery. And we've done that, and we're going to continue to allow for the CDC recommendations of opening windows when conditions allow. And we have reviewed this with the safety team. I think they were all in agreement and understanding that this is a pragmatic, practical way to approach the situation. And certainly open to any questions about that.
Okay. Thank you, Ed.
Okay, so I'll continue. You want to pause at that one or go through the whole thing until we're done?
Either way, if there's any questions, particularly on the HVAC.
Sure.
Gretchen?
Thanks. And I already asked this in the committee meeting, but if you could just remind me. So what is the temperature in which the recommendation will be to not have windows open?
We haven't set a specific temperature at this point, and we may revisit this if there's too much indecision, but we're leaving it at the discretion of the professional staff to be able to monitor their classroom and understand, when it's too cold, when kids are shivering, that they need to close the windows to get the room heated up without giving them a specific temperature. I would anticipate we'd be in, typically, people start to feel chilly and, in the mid to upper 60s within the room. And again, without giving a specific temperature to people, at least starting this out, we're going to try giving people discretion. If we run into issues, we may have to revisit that.
Okay, I guess what I meant, maybe I worded that awkwardly. What I meant was, I remember you talking about that the HVAC system cannot work if the windows are open at a certain temperature. And so it's great to leave it up to the comfort level of the individuals in the room. But just in terms of the HVAC system, or maybe it varies by building, because I know some are older than others, but at what temperature does it not work if you have the windows open? Or I don't even know what not work is, but I remember you talking about this, that at some temperature, it becomes problematic to have the windows open because the system will not work. And so that's the answer that I'm looking for.
Yeah, similarly, there's no set answer to that question. It will vary by building. It'll vary by side of the building. A building with the southern exposure side will be different from the northern exposure side of a building, so it will be different in different classrooms within the building. So there really is there's not a set temperature I can give you to say that this is going to be it. I would predict that, and again, windy days versus non-windy days, sunny days versus cloudy days, are all have impact on when the system's not going to be able to keep up. So
I'm wondering if there's a range, and I'm wondering if, because I had thought that you had said that there would be some kind of, and I'm just trying to get the answer. It's simply for information. I thought you had said that the principals would be notified what the range would be, but now you're saying that it would be completely up to the teachers, which is great. I mean, they're the ones living it. And so there is no range, no information. It's purely 100% the decision of the teachers when they have the windows open or not, because we know that even with the window slightly open, it increases the safety in terms of possible transmission. And so then it would, I guess, be left up to the level of risk acceptance versus risk averseness of the individual teacher. I'm just trying to figure out who decide what is the answer. And it sounds like it is up to the individual teacher or staff person in the classroom.
Yeah, Gretchen, you're right. We did discuss a lot in the committee. You had some open discussion about this issue, and there was a suggestion that maybe we establish a temperature that, and I think I know that as I talked through it, I tried to indicate that I didn't think that would be to pick an outdoor air temperature would be problematic. I think and I don't recall, because we've talked about this at committee level as well as safety team level. So I don't want to, I may be getting different conversations confused, but I know that coming out of our final safety team meeting, and we were going to start this off with, at the discretion of the professional staff, in all cases, with the building principal being the lead educator in the building and having that individual help when there were questions in terms of what was acceptable versus non-acceptable.
I think that sounds reasonable. Different buildings have different effectiveness of the systems, and we have newer systems in some buildings and older systems in others. And I think that if there's any concerns about it, obviously, we'll communicate with our principals and tell them to have a conversation with their faculties and see where people are with any questions or concerns about it. But right now we're not there in regard to the super cold months. But we're going to have some cold days coming up. So this will get a trial run here coming up with some of the cooler mornings that we're having, and I don't think we're gonna pick up.
That makes sense, Bob. And that's why I asked, does it depend on the building? So, and I mean, that makes sense that it would be up to the teacher in the room. I do wonder, just in terms of like people who study this, or I don't know if that would be, Matt and Maciek, or, someone else on the safety team, the nurses. I wonder if there's any safety benefit to just on super cold days, just having the windows open during lunch when people don't have masks on. Just a question. And thank you, Ed and Bob, for answering. Thank you.
I think that's a good point. Kids are unmasked, they're eating lunch. That's obviously a time where ventilation's a smart move, no question about it. So we'll take that back to the team, and I know we actually have a conversation on Wednesday morning with all the principals in the district. So it's I'm sure they were going to bring it up if we didn't.
Thank you. Laurel?
Thanks. I thought at first Gretchen was asking the same thing I wanted to, which is why I put my hand down, but now I think maybe mine is different. I was actually wondering if we have guidelines for the inside temperature. Not knowing how we get there, but I'm thinking of, back in the day when all federal buildings moved to 68 degrees, do we set a temperature within the building? And in particular, if we make it lower, that's something that we probably should let parents know in terms of how they talk to their children about dressing. And it may well make sense to have a somewhat lower recommended internal temperature than we have had in past years. But do we have one even?
Yeah, we do, Laurel. We strive for 68 degrees in the wintertime. We do, particularly in our newer buildings, have thermostats that allow for some personal discretion to adjust the setting at the room level, up or down 2 degrees. So that 68 could be in the 66, 67 up to 70-degree area is what would be our typical room temperatures for winter time. I would expect that, I'm hard pressed to give you a definitive, low point temperature at this point, but I think once you hit 65, 64, people are going to start to feel, particularly for long periods of time. I mean, that's refreshing. If you go outside, in the wintertime and, it's a 65-degree day, it's great. It's refreshing. But to try to work in a 64, 63, some people are going to start to feel uncomfortable, for long periods of time there. So I think that temperature, also has to do with duration. And I know I'm really giving very fuzzy answers, but it's a very difficult one to try to legislate a prescribed temperature. If we run into issues, we may have to revisit that, like I said earlier. But we're going to try our best to work with people to come up with the most reasonable situation for each classroom.
No, that's fine. If it's around 68, I more was thinking about in terms of guidance for families and how the kids dress. So thank you.
My advice will be bundle up.
Yeah.
But I do think we want to see how it goes and then communicate accordingly from each of the schools so that if we are asking parents to, send in an extra layer or something like that, because we are going to continue to ventilate and have some windows cracked, then I think we just need to be upfront so kids aren't too cold.
And a lot of the boys will still wear shorts.
But
at least we're letting them know. Thanks.
Okay. Jean?
Yes.
Yeah, I
All
think
right.
you had more
Yep.
to continue with, right?
Definitely. So thanks, Ed. And so now we'll move to page 18 of the document. And these are minor changes, nothing major, but enough that we thought we wanted to bring some clarity to them. So on page 18, because of the FDA approval for the lunches and the breakfast, we have increased amount of students at the high school who are purchasing breakfast now. Because of the size of the high school and the time upon which they arrive, there's not time for them to all go to the cafeteria and get their breakfast. And so they've set up different places throughout the building. The concern was in the safety plan, it specifically said that the high school would eat in the cafeteria. And we have found that that can't be the case for breakfast, and not for all kids, just for the kids who come to the side of the building that is not the cafeteria. And so we revised that. So high school breakfast students are encouraged to eat in the cafeteria, but will be allowed to eat in the hallway so long as they are physically distanced and not walking while eating. Okay. The next revision is on page 22. And that was just removing one line. We initially had changed this to mask wearing at all times while using playground equipment. And we found that that was too difficult to police. And so we are having them wear a mask all the time, but we do have spaces designated for mask breaks. So we wanted to make that revision. The next one is on page 33 and 34. And so on page 33, we had wanted to put clarity to this after we have gotten into the business of communication and what we needed to put in there and how to do this in the revision process. We've wanted to revise this to make more sense to how to do this. And so we deleted shared building location, direction from Department of Health and Sanitizing, and included in the following order: we will communicate building employees, building parents and guardians, post on the district website, and update the district dashboard. A good example of this where we had some late in the day dashboards late Friday evening, and we could not put them on the dashboard. I'm sorry, in our form that we needed to update. We could not update the dashboard until we had did the contact tracing and communicated with everyone. So some people were asking why it didn't go on the dashboard till later on Sunday. That's the reason. We needed to make sure we followed those steps first. And then on page 34, we wanted to add transmission within schools. We have found that to be pretty critical and something that is worthy of being on this list because we heard from the epidemiologist, it's commendable where we are and we need to keep up that work, and that transmission within school is definitely a trigger for us to seriously consider moving into remote. That's it. The other red areas you'll see are duplicates from the sections. There's two, they're copied over in two places. There is one more place at the beginning that I will mention. We had commented that we were meeting twice a month for the safety team, and we have realized that we needed to meet twice a week. So we're meeting twice a week and have been pretty much since the start of the year. And I don't see that going away for quite some time. So those are the updates that I had for the safety plan. Any questions?
Lori, I see your hand raised.
Thank you. My question is probably really simple. So the change that you made on page 33 about the following order: building employees, what's the typical amount of time from, beginning from the very first step to getting it on the dashboard?
We usually try to get it done within the day. So if we get something on the board, by the time we can circle up and get those communications out, it can be rather quickly depending on if the student was in school or wasn't in school, how much contact tracing we need to do. So we need to make sure the contact tracing happens before we can then communicate with everyone. And so that really depends on that. This weekend, it was quite a debacle with some of the ones we had. And it took, I bet, 15 to 20 hours to contact trace just one particular family that we had. So it really varies, but we try to get it, unless it's on the weekend, within the school day, within the 24 hours. But by the end of the day, usually we have it ready to go. I don't know if anyone, go ahead.
Yeah, so contact tracing typically sounds like it goes pretty smoothly and quickly.
Depending on the case, yeah. So like I said, thanks to our nurses and our families, when they have a positive case that they know that they've been exposed to, or that there's someone in the family, they have been pulling their kids out before there's any symptoms. And our nurses have been sending home kids very frequently. So that has really kept kids from being in our building, where contact tracing has to occur within the building. So it has been it's a lengthy process, depending on the number of details. Each nurse, I'm told, spends probably 2 to 3 hours every day, first thing in the morning, just going through that process.
Wow. Okay, great. Thank you for that.
Sure.
Okay. Any other questions on the safety plan update? Okay, I think we should take a few minutes break before the next item. So we will adjourn briefly, and then if everyone could turn your cameras back on when you get back, so I'll know everybody's back. Okay, thank you.
I'm back.
Okay, it looks like we're all back except David and Amy. If you guys are here, oh, there's David. Okay, maybe we'll go ahead and get started. So item B under safety is the proposed athletics plan for winter and spring. This is shown in attachment 6B.
Sure. Amber, I will kick it off this evening. Along with me, obviously we have Gene Canals here, and then Chris Weekland and Lauren Crispel. So I'll just start off by highlighting some of the key components of the health and safety plan, because you all have a copy of it and have seen it. Couple things to point out. Number one, this is the health and safety plan for the winter and for spring sports. We decided as a team that we wanted to try and combine both plans together so that we're not bringing a separate plan together for every, or bringing a separate plan forward for every sports season. We did find that this health and safety plan, we've incorporated most items from the fall health and safety plan. So there is a lot of overlap to this plan. So tonight is just to share this information with the board and the community, and then we're going to be requesting that the board consider approving this plan at their December 7th meeting. So again, we're just presenting it tonight. But some of the key safety measures in the plan include a reduced competition schedule. Our plan would postpone the competitions to not begin before January 1st. And Mr. Weekland just told me this afternoon that there's some discussion in the mid-pen about doing something along those lines. They had a preliminary discussion today, so the league may be considering pushing back the start of the season like they did in the fall. But in our plan for SCASD that we have that in there, and we are recommending that we do not start until January 1. Also, key measures in the plan would be mask wearing, hand sanitizing, temperature checks for all athletes and coaches before practices and prior to travel to competitions. We also, similar to the fall plan, we delineate between the non-contact and contact sports for when or if we would have to move to a full remote status. Similar to the fall plan, this plan was developed with input from our health and safety team. You heard from many of them tonight, but it includes physicians, epidemiologists, nurses, like I said, all whom are part of the team. So a couple key components of the plan. When the district would be in in-person status, all winter sports will participate in the reduced competition schedule, mostly within the conference. So I did mention we're not planning to start until January 1 or after that, and we are looking to do most of our schedule within the conference, the Mid-Penn Conference. When the district is in fully remote status, so if we would have to move to fully remote status, then the non-contact sports, they would continue to participate in their reduced competition schedule, mostly within the conference. Again, very similar to what we had in the fall plan. And the main reason for this is that these sports have no variance of risk, whether practicing or competing. Conversely, if we were to be in the fully remote status, the contact sports, we would switch to operating under the SCASD interim athletics health and safety plan with no competitions outside of the school district. So students would still be able to practice, could scrimmage internally, but there would be no competitions for those contact sports. One change that you'll notice in this plan is in the fall, we had the high risk sport football. We required those students or those athletes to go fully remote after their competition. We do not have this in the winter or spring plan currently. We had a lot of discussion with the health and safety plan. There were no other football programs that we came across this year that had that in their plan, that they required students to go full remote. So based off of the success that we had with our fall health and safety plan, particularly with the football program, what we've seen from other districts in our conversations with the health and safety team, we did not feel it required to have sports. And I know someone mentioned earlier wrestling. We did not feel it required those high contact sports to move to fully remote after their first competition or during the season. Some other modifications, transportation. Again, what we did in the fall, the 6-foot physical distancing on the buses will be enforced. And we highly encourage parents, if they can, to transport their sons or daughters to away competitions. And we've had good success with that in the fall. As far as personal protective equipment, we are requiring face coverings. Coaches and staff will be required to wear the cloth face masks or other approved face coverings at all times during practices and competitions. For indoor and outdoor sports practices and competitions, cloth masks or approved face coverings will be required while idle and not engaged in physical activity. So students on the sideline, students that are on the bench that aren't competing are required to have face coverings on. As far as screenings, all coaches and athletes will continue to complete pre-screening electronic form prior to each practice and competition. All athletes and coaches will have their temperature taken before their practice or travel to competitions as part of the screenings. And the health screening form will also be completed by visiting teams prior to their departure to come to SCASD. And then as far as spectators, we'll adhere to all the state guidelines regarding spectators. So that's just an overview of the plan. I didn't want to go through it page by page because, like I said, it closely resembles what we did in the fall, but like I said, our team is here and we're prepared to take any questions that the board may have.
Dan?
Yeah, well, thanks very much for the update and for the review. Just to clarify, in relation to the experience of the football program, and as you're describing, as I understand it, there were no indications of infection on the part of our players during the period that they were in remote instruction during the season. But as I recall, a number of different local football programs either had to postpone or cancel their competitions based on infections that occurred either within their own school program or the opponent's school program. And I think we also had to reschedule ours. Was it with Harrisburg? I think we moved it from a Friday game to a Monday night game to accommodate. So it's not as if these are without risk. So I guess here's a question in relation to the plan that we have. How sensitive will it be to these events in terms of our, basically discovering, and this has happened, that we're competing with, or have this, we discovered we've competed with a team where someone was determined to be positive within a day or two of that event, or it might have even have withheld their symptoms in order to be able to play. Would not be impossible for a young person to make a decision like that. And so I'm wondering, how sensitive will the plan be to these circumstances in which we may wind up competing against another team that happens to have one or more infected players?
Yeah, and that's a good point, Dan. I do want to mention, I know you had shared last time, we did take some input from CCL, and we did include that in this plan, saying that all of the parameters for our health and safety plan are included in here. But you're right, there were some times during the fall where there would be a team that we played or were scheduled to play, and they would have cases on their team. And the case in point was this past Friday, we were supposed to play a team from Lancaster, Manheim Township. They called us and they had some cases, and the game was canceled, so we didn't play. So what we have found is that if there is any case, whether it's obviously if it's on our team, we shut it down immediately. But if we find that it is on another team, we get together with our health and safety plan. We take a look at the I'll say the facts of the case, the information that we have, and then each individual situation, we sit down, we talk about it, and based off of the input that we get from our experts, we respond accordingly. That could be quarantining the entire team. That could be quarantining just athletes that had close contact with the infected player on the other team. So we're very sensitive to that. And, a word we use a lot is abundance of caution. And we apply that to our in-person school, but we apply that equally, if not more, to our athletic plan as well.
That's great. Well, because from the feedback and the report we received this evening, I think within our own system, we've got a pretty robust protective program when it comes to infection. We're working on that almost, as Jean was saying, 24/7, including weekends, to do this kind of work. So my basic point is, I think we need to, in terms of our decisions with our engagement with schools and programs outside of our region or outside of the school district, I think we have to be sensitive to the risk for introducing cases into the school district, and along with that, I think an abundance of caution would be the threshold that we would want to follow in terms of protecting our system from other communities, and not to fault them necessarily, but they may have different financial resources, different standards than us. So I think we need to be respectful to the work that we're doing here, that we do all we can to protect our students and our staff and the families in the community and so on. Thank you.
Dan and Will, I just want to share a couple of reflections. Back in the summer, we were worried about rates in other communities, and then I think other communities worried about rates in our community, and
right.
could flip back the other way. So we want to reserve the right to withhold a team if we think a situation is concerning. I can tell you that, well, Harrisburg was never on our schedule, and then we kind of did them a favor, but then following the game, I received the call, and they approached it with quarantining their team, even though it was questionable. They didn't have all the facts to say they had a close contact because it was just over the 48 hours, but they said it was close to the 48 hours. So we're quarantining the team. So they withdrew their team from the playoffs, which was tough to see on their kids. But, you know, they so far, my point being, all the districts, obviously Harrisburg in that instance, and the athletic directors from other districts that resulted in us quarantining, including, I believe, Huntington, Mifflin County, you know, their athletic directors called Mr. Weekland immediately when they became aware of a situation. And then we quarantined some of our teams because the opposing team had a case that evolved within that window. So I just wanted to share that so far we've seen other school communities that have been very forthright with calling us directly, and we really appreciate that. So we want to maintain that. And then also I wanted to share a point with the contact tracing, with not just with our teams, but with local youth teams. We have more students that are involved in youth experiences throughout our community and beyond. And I think that's an easy calculation. But, you know, our nurses and the relationships with the parents, we want to have a positive relationship so that they'll be willing to talk to us and be willing to cooperate when we say, hey, you know, there was a close contact or a case. We need you to quarantine. And thus far, we've had some positive conversations. Not that it'll always be that positive, but you know, we're reaching out beyond just our programs. Our programs themselves, we have the ability to shut down as we have in the fall if we have any cases. And I just wanted to reflect on that. It does give us the ability to shut things down immediately versus youth programs. We don't have that authority over.
Thanks, Bob. Thank you.
If I could add there, Mr. Duffy, thank you. That the one game that you were talking about that we postponed from Friday to Monday was a Carlisle game. And again, that was out of abundance and caution on our end until we finished up some contact tracing and realized that we actually didn't need to take any action, but we crossed the threshold as far as playing that game that night. So we rescheduled for Monday. We're in constant communication with the athletic directors throughout the league and the state, and the communication has been great. As you stated, we do have a robust plan that is pretty thorough. And I think the evidence of that this past fall, as you know, I think we only had 4 student athletes out of the 700 plus that were COVID positive, and it was all introduced outside of competition and play. So that's, you know, at about 0.5% of our athletes. So it has worked, and we feel pretty confident in the plan that we have and the successes we had this fall, and hopefully parlay that into the winter.
That's great, Chris, and thanks for clearing that up. I neglected to remember that it was Carlisle that was moved to the Monday game. So, but at any rate, yeah, I'm not in any way suggesting that anything has been a problem up to now. Just trying to make sure that whatever plan we have, that it's as airtight as possible going forward. And it sounds like, given the ways in which Dr. O'Donnell and others have talked about it, we have the means by which we can respond appropriately in any given situation. Thank you.
Scott? Oh, you're on mute.
I'm sorry.
Well, that's the first time that's ever happened to me. So a question and a possible comment on competitions when the district is in full remote status. You know, while I don't agree, I get the abundance of caution, you know, from that consideration. My question would be, considering all of the different factors that could go into us going remote, some of which may actually not have to do as much with, risk of spread versus, teachers, shortages, other things that may or may not have an impact on, on the risk in athletics. And I would just ask if we could not necessarily take that out, but adjust the language in there to similar to one of the, I think the second iterations of the safety plan that basically gave more consideration to the totality of information in making a decision versus a hard and fast kind of bright line test of if then else, if we're remote, then there is no competition versus if we're remote, then a decision will be made on, whether it's a sport by sport basis or, a further decision will be made at that time, whether competitions will be permitted to, to continue. So that would be my only comment. Just again, not that it won't still come to the same result, but will at least allow there to be some consideration or flexibility in the potential for information that we might not be able to anticipate at this time. Thanks.
I think the point, if we did close because we had, say we shut the high school down because we were having some staffing issues with teachers in quarantine, and it could be because, they've been exposed outside of school, or obviously if we're seeing transmissions in school and we close, I think that's a different issue. I think then things on a campus need to shut down. But if we're closing because we're struggling with operations and some of our employees, and we're not seeing it among our students, I think that's a reasonable question. And so I think I'll gladly, ask the team to think about that and how that impacts programming if we close when it's not necessarily a community transmission issue that is why we're closing. And if it's say we close for a finite period because we want to cover a quarantine window, I think that is a different scenario than if we close because we're seeing transmission in the building.
Yep, and that's kind of exactly where I'm coming from on that, Bob. And the current language doesn't give you all the flexibility to be able to assess that at that point in time.
Lori?
Thank you. I guess so when we vote on this, on the health and safety plan, are we voting on whether to go forward with the winter season on that same day? Is that right?
I don't know if does the health and safety plan edits. I don't think they need an action on that, do they? Yeah, I think that was.
Oh, okay. So it's just a review. Okay.
I do think the athletics competition plan is what you'd be voting on. Yeah.
Okay. So my question about the health and the athletic health and safety plan is regarding the health and the team that we have. Have they gone into this process thinking that this is a good idea, or have they just gone into the process trying to help us make the best decisions possible for an athletic season? Does the distinction make sense to you? Do you understand what I'm saying?
No, I think even in the fall, Lori, I mean, they all agree that there's a higher risk behavior here. And, obviously our screening process, what protocols we have in place, and then what are we going to do if we do have, they saw what we did in the fall, and if we do have situations, then we would act quickly, and we did that. So I think if, obviously if we see, since we're indoors for most of these sports, because I do think indoor track, depending on how difficult of a winter we have, I know they do a lot outdoors when we have a more mild winter like last year. So, and I know that because I was getting calls about the lights at the South Track. So I knew they were out there a lot, and it was good that they were out there a lot because they were getting a lot of good workouts in. So with that said, I think if we did see multiple teams with cases, I think, it wouldn't be a question of what do we do with one team. It would be a question, are we going to shut all indoor activities with these high risk behaviors down? So, that would be a conversation with input from the safety team. We would be sharing the contact tracing results of individual cases, and then making, a decision after getting their input. But I think in regard to individual teams, if we see a case or we're aware of it, as soon as it comes to us through the ADs and the nurses, we'll make a decision. If we think it's bigger than that individual case, well, then we'll circle up quickly. And if we don't have a decision because there's so much to go through, then we'll just put a pause on everything.
Mm-hmm. Yeah, that's helpful to know. As we think about this the next couple of weeks, I just want to be fully transparent about where I am right now. In this moment, I'm really reluctant about this. Every expert that we hear talking about this is talking about how we're entering the dark days of this pandemic, and they're expressing all these dire warnings about what's coming. And I think we have a responsibility not to add to the risks. And, as we're talking about, these are indoor events and not outdoor events. And we have an exacerbated problem with the pandemic spreading. And so for me, right now, in this moment, I just feel like the green lighting of athletics it sends a message, and I think it contributes to a narrative that things are okay. And I think that narrative is false. And I don't know that I feel comfortable with all of the protocols and with all the good news about our mitigation. I don't know that I feel okay about risking our kids' health, by association, our teachers' health and our community's health. And I just don't know right now that I feel good about supporting anything that is going to add to the risk. That said, I support the health and safety plan because I think it's a great plan, and who knows where we're going to be. Maybe come time to vote for this, things will look really good. Certainly by spring, I would imagine that things will be better, but I just want to be transparent about where I am with my colleagues and with the community and my thinking on this. So anyway, thanks for hearing me out.
And I think when we went into the fall, we were questioning how it would go. And, our highest risk program that has a lot of student athletes, it doesn't mean that we didn't have any asymptomatic cases, but we didn't have any cases come forward through middle school, junior high, JV or varsity football, which was I was surprised.
Laurel?
Thanks. One is, I think this is a typo, but on the cover memo, basketball is not mentioned. It's on the health and safety plan. It comes at the start of that list of high contact sports, but on the memo, it's not there. So I assume that's just a missed thing. When the district is in fully remote status, non-contact sports, contact sports is not listed under contact sports on the memo. So I'm just confirming that was a mistake and not that we don't consider it a contact sport.
It is listed as a contact sport in the plan.
Yeah, it's in the plan. It's just the memo that doesn't have it.
Yeah, we missed it. We missed it.
Okay,
in the memo.
I'm just double checking because I had missed it as well. But then as I was thinking about the difference between winter and spring, the big one is indoor versus outdoor. And that's where I have, I think, maybe a similar thing to what Lori's thinking. I'm more concerned at this point, certainly about the indoor. And I want to understand more what you said about football in terms of we had that extra condition. And you said it was because in this listing of high school sports, it was the high risk. Are none of the winter sports fall under that same rating?
No, we do have some winter sports that do fall under that high risk, similar to football. I think, and Chris Weekland, you can help me if I know wrestling falls under there. Not sure if ice hockey was at that level or not.
No, ice hockey was not, just wrestling and competitive cheer.
Competitive cheer. So those two sports, Laurel, do fall at the same level that football did in the fall, but based off, and we had a lot of discussion around this, but the health and safety team felt that to keep those kids out of school when our protocols, at least in the fall, were successful, did not think we should include that in this plan.
I guess my concern, especially given the indoors, is maybe not so much us, but other people. They're going to other buildings. We have the advantage now of some very nice new facilities with good airflow and all of those things. But, you know, it's so hard because when it works, you think you can back off. But it may be that it did work well. Things could potentially have been different with just one or two accidental exposures at another location. When you're indoors, it seems to me that's compounded. So that's making me concerned about that more so than the spring sports. The other question I had, because this talks about the winter competition potentially not starting till after the new year, is would you be coming back to us for the competition part of spring sports, even if the health and safety plan was all set?
We wouldn't, because it would be in this one.
So it would just be assumed that unless we intervened otherwise, spring competition would start whenever it normally does, and we wouldn't double check that. Okay.
Most of that is outdoors, but yes,
Right.
that's correct.
And then one other thing that I just could use some clarification on, because I don't know the sports term. The conference, many of those teams are far away. So we're actually giving preference to those far away competitions that involve the added risk of travel over local competition. And I'm wondering why.
I can speak on that. Our conference is the Mid-Penn Conference, obviously, which is primarily focused in Harrisburg, but we also have Altoona, Mifflin County, that is more local. They are of equal size as 6A school programs like ours. Our local school districts that are more in a geographic region are not of the same size. So they have their own conferences. They have their own conference schedules that they fill that would not necessarily include State College because of its size and the fact that it is not within their conference. So their priority is going to be scheduling their conferences and not necessarily opening up their schedules for us. So
That's very helpful. Thank you. Because I was very confused by that. So it's really a matter of they've got their own things to do. We don't fit into them.
right.
Okay.
Yeah, you bring up a great point, and that's something we really explored this fall. And on paper, it sounds great, but in actuality, it really did not work because of the fact we had to integrate into other conferences that have smaller teams, and it really didn't work.
Okay. Thank you.
All right. Any other questions on this? Okay. All right. So this will come back.
Amber, I did.
I'm sorry, Jim. I didn't see her.
No, I didn't raise my hand. I'm sorry.
Oh,
about
okay.
that. So one of the things that we've gotten some email about is in particular is the wrestling program. And the idea is that there's some tournaments that happen before the fall break, and including King of the Mountain, which is a fairly prestigious one. And so the idea is that they would like to participate before January 1st, right? And so I think I'm with Lori, where Lori is on this, but I do want to bring that up in terms of that. I think King of the Mountain lets you appear as an individual rather than a member of the team. Now, the other one we're involved in, it sounds like it's an 18 bracket, so that wouldn't work out at all. But what would be your opinion on that, I guess? maybe Lauren is the expert on it.
Did you want to take that one or take it?
Yeah, I don't know.
Wrestling is a unique sport. It's unlike any other, to be honest with you. And we've talked about this quite a bit with the wrestling community and our coaches and others throughout the state. For indoor practice, we have wrestlers that are just going to wrestle each other. They're going to be in a 10-foot area. It's just going to be one-on-one. So there's really it's unlike any other sport. It's not like they're in contact with 5, 6, 10 other individuals. It's really limited. One pairing that they stay in that pairing throughout the entire practice, and so on and so forth. So we encountered, obviously, this past fall a very large tournament in our area, which some people labeled as a super spreader, and which did involve a lot of our athletes, but actually in reality did not turn into a spreader at all. So there mitigation, there's safety precautions being taken place that really have been effective, and that's the one thing that we can learn is what is working and what has worked, especially with some of our friends in the travel programs and the club programs that we can apply to ours. To your point, wrestling is a unique sport in the fact that there are a lot of tournaments. They do have 3 tournaments that have been scheduled prior to the start of the new year, one of which the tournament director has already canceled. And the one you're making reference to happens right before holiday break. So it really could be something that we could probably entertain the fact that we could maybe, they have kind of broken it down into a dual tournament where we'd be given a certain time period to enter the gyms and play and compete against a certain number of other schools in that time period and then leave. So there's mitigation steps that they're taking that could make it really attractive and potentially something we'd want to look into. And the fact that it occurs right before the holiday break would not mean that we would bring it into our schools. Maybe it's something we can take and look at and see and allow the holiday break to be a period of time after that we can monitor their health. So it is a unique sport. It has a lot of things you look at and think, wow, they're wrestling right next to each other. Yeah, but it's only for like 2, 4, 6 minutes tops, and they're not always engaged. It's something I'd like to look at and continue to learn from. We've reached out to Penn State to talk to them about what they're doing. So there's a lot of conversation being had throughout the state on this. So.
And, when I was looking at the schedule, like you said, the one tournament is already canceled. And it looked like we had one home and one away match on the schedule that you'd sent us. And I didn't know if both of those teams were in the Mid-Penn. Shikellamy and Chambersburg is, right? But
yeah, that's the other unique thing with wrestling. We are actually in 2 conferences.
Oh, yeah, that's
Big
right.
7, and Shikellamy is part of the Big 7.
Oh, okay.
Yeah.
Okay.
Yeah.
All right. Because
Jim, I'd like
working
to
with
just chime in as well to add a little bit to what Chris said about wrestling. I do think that we want to remain sensitive to the run-up and rigor that wrestlers need to make sure they're prepared. Obviously, we'd like to do it all. We'd like to have our cake and eat it too, and give them a schedule that allows them to be ready and qualified for the postseason. And in order to do that, they've got to hit a certain threshold of matches, both individually and as a team, to qualify. Individually, you don't need as many. Team, you have to hit a certain number of points or matches to qualify for the postseason. And we've got to be sensitive to the idea that we can't just ask them to compete in 9 matches in 14 days, for instance, at the end of the year, and expect them to be ready or expect that to be safe for them. It's not. So I do think that we want to remain sensitive to the types of tournaments and the formats of tournaments, as you alluded to and Chris mentioned, dual format being preferable. I think the individual tournament format is a little bit more concerning because you have constant in and out of all of your wrestlers, and that's at different times throughout the day. Whereas, as Chris mentioned, a team dual format in tournament allows you to get in there as a team, wrestle your match, come back out, and then re-enter if you need to later in the day. If we were to lose a tournament during the month of January or February for some reason, we've explored the idea of trying to find two different opponents, perhaps, that either could come here or we could wrestle elsewhere under that format. So we could recoup those points and not lose those valuable points for our team and the matches for our wrestlers, and maybe not necessarily be part of the tournament, but still get 2 or 3 matches in a given day. So you mentioned King of the Mountain. King of the Mountain has worked hard, I think, to try to find a way to make it work and make some concessions. They're looking at switching from that individual format to a team duel format, which again poses great value for us. So I think we want to be sensitive to all of those things and also do it in a way, as I said, that allows these wrestlers to be safe, to do it in a healthy manner, and to be prepared and qualified at the end of the year for their postseason aspirations as well.
Yeah, and I know, Chris, we have the sort of the competing stuff that it's 6 minutes and maybe what do we euphemistically call it now, a sudden victory, instant victory win. So it, could be, 7 minutes or so, but I would think it would mostly be impossible to stay 6 feet away, unless you have really long arms. So we have to acknowledge that during those 6 minutes, they're in close contact, particularly the faces, right? So it's a hard one. It's a hard one for me, I think, to think about it that way. So I just wanted to bring that up because we have gotten a few notes from, wrestling parents about wrestling, and in particular mentioning the event that you mentioned, Chris, in terms of this summer and it not appearing to be a spreader or super spreader event. Thanks.
I appreciate the question because I think it is very intriguing, and I think to Lauren's points, there's a lot of value in what we could do for them. So I think it's something worth continuing to pursue.
Scott?
The thought I would have relative to wrestling might key on a point that Chris made, which was, we're looking at January 1 as the start of competitions, yet if I remember the calendar correctly, December 24th, or 23rd would really be the last day of school. So there is no class that last, 7, 8, 9, 10 days, whatever of school. So it wouldn't be difficult to move the start of competition back to the end of school. And then what I'm wondering is, if it's something that is meaningful in that sport, do we look at it and say, well, you can have a competition earlier like we did for golf, and the wrestling kids have to be remote if they choose to take that opportunity. So, that we do have some mitigation of spread within the school community if a wrestler would choose to do, that event that was a little bit earlier. So I don't know what the dates of the King of the Mountain tournament are that are being referenced, but I do know that it's a big deal. It's a big deal in the wrestling community. So I'm just wondering if that is a possible, I don't want to say compromise, but I wonder if that's a possible, acceptable, risk assessment of saying, you can compete before the break, but you have to be remote, from that point until, the end of the break. Just a thought.
I agree with you because even our competitive cheer team is in the same scenario. They have a district play or championship tournament right prior to break as well. Now, again, they're listed as a high-risk sport because there's a lot of contact. However, they don't have contact with other athletes. The difference between their practice and their competition is nothing. There's no difference between the two, much like golf and tennis as we learned this fall. So I think there's opportunities that we could really, individualize some of these opportunities for these teams and try to make the best decision for them. Maybe add, as you mentioned, some other levels of protection as we do.
I think for the board, just to understand why we didn't pull or say any teams would be quarantined or fully remote like we did with football, was when you really look at the behaviors of basketball, to compare that with other sports and here competitive cheer. I mean, when you watch what's happening on a court, boys and girls, especially when the ball's around the basket, there's a lot of pushing and shoving, and people were just sprinting up and down a 94-foot court or 92. I mean, so to say you're going to exclude this group of kids and not this group of kids, I think is where we were really struggling. And obviously this whole practice time or run up to the actual competition season is also an opportunity for us to monitor these indoor activities to see if we're going to even be able to compete and that things are working. So, that's why we didn't include excluding student athletes, because of, the opportunity to have all the local time here, and then also what we had in the fall. And we were splitting hairs over which programs do you really, how do you justify excluding that group when you know the behaviors and the activities happening with another sport. So that's why, we felt comfortable with the contact tracing and how quickly we excluded teams or shifted them to remote in the fall, including the indoor team that we did that with.
Yeah, and Bob, I appreciate that, and I absolutely agree with that. And I was approaching it more from the standpoint of, if in fact the district or the health and safety team or the athletics team feels that there's an increased risk for some reason associated with having competitive events in 2020, and I'm hoping that there is some presumed or perceived risk there, or else we wouldn't be pushing things back to 2021. So if there was that increased risk there, my only thought is relative to this scenario with wrestling or competitive cheer, that having them be remote just for that time period in 2020, not as an ongoing consideration in every instance thereafter, that if we felt there was more risk associated with competitions in 2020, that having them be remote would be a way to mitigate whatever that risk was. So, but I agree 100%. I would not be singling teams out to have them go remote once the kind of the official competitive season started in 2021, as we've assigned it. So.
I kind of wanted to circle back to the question of whether practice was more or less risky than competition. And it really does seem like, once you bring another school community and their potential germs into the mix, it seems like it's intrinsically somewhat more risk than the same people you're with every day in practice. I mean, obviously we get comfortable with known, who we know and we're familiar with, and it doesn't mean they're actually less likely to be COVID positive, but adding to your bubble, it's an additive risk. So, Laura?
Do we have, and I may have missed it earlier, I'm sorry if I did, do we know when we might hear from the MidPen?
They're meeting tomorrow. We had some informal conversations with athletic directors today. There was a survey that went out today as well, late this afternoon. There's a MidPen athletic directors meeting tomorrow to discuss possible results of the survey and then possible adjustments that they want to make.
But right now, it looks like they may postpone until after the first of the year, but it's not certain.
Not certain at all. I don't want to jump to conclusions or speak for anybody there. Just in the informal conversations that I've had with other ADs today, there's some speculation that there could be a delay to the start, but the details of that would be forthcoming.
But they are practicing so that if competition starts and we vote to start, they will be in shape to start.
Right, because if we postpone the start of practices as well, we still need 15 practice dates before we can compete. And with the holidays and such like that, we really can't push back practices too long, and still want to be able to compete on time. But there are some equations to this that that go hand in hand with practicing and then starting a competition schedule.
Okay, thank you.
Sure, thank you.
Okay, Amy?
Yeah, sorry, I had to step away for a small family crisis, but so I apologize if this was already covered and I missed it. But one piece of data that I think would be helpful, and I don't expect you to have it at the tip of your fingers, but perhaps it could be shared with us, would be the number of students who have had to quarantine due to exposures through sports. You know, or the times we've had to cancel a game because another team has had positive cases. Like, so when we're asking ourselves, how risky is it to engage with other communities? So some data we could try to look at would be that kind of information from the fall. And also in comparison to the number of students we had who perhaps had to quarantine due to exposure in the community. So a comparison of our total number of students who perhaps had to be out of school due to an exposure, how many of those were community exposures and how many were via sports? And I know that's a little bit hard to interpret because our cases in the community are higher now than they were in the last 2 months through the fall. It will at least give us some sense of our exposure in terms of what sports brings to the community. And I don't need that number right now. I think that probably you'd have to collaborate with administration in terms of getting the students who have had to quarantine for non-sports related reasons, but I think that would be very helpful because I know we have had reports of kids who have been exposed through sports and had to be out of school.
I can speak on that number right now.
Okay.
PIAA sports teams and student athletes. We have had 4 student athletes that had COVID on our over 700 plus student athletes this fall. So that equals to about 0.5% of our student athletes that had COVID. And every single one of them were directly connected through contact tracing to an outside contamination and not during play.
Okay, but that's not my question, Chris. My question was about, because part of it is losing staff and students being in person. So I'm more interested in exposure, not necessarily just positives.
Right.
So what do you mean by exposure in school? Like, can you be specific on?
Yeah, like how many students have had to quarantine because they've had an exposure? So for example, the volleyball team had an exposure via their experience in sports. And I know that didn't come from other athletes, but we also didn't, trying to remember.
So we have those numbers.
Whether we didn't have to quarantine some football players after being exposed to another team with a positive because they were already on remote, but we did have some soccer players, right, that had to quarantine after an exposure to a positive player elsewhere. Like that kind of situation.
Football. That's not true about football.
Okay, I couldn't remember properly. I said I wasn't sure, but
they were the contacts was the Harrisburg team. They didn't send that particular kid. So they were our kids were contacts of contacts. So we did run that through the safety team. But I think the total number of kids quarantined seems to be one of the questions, which I think we have that number because we know with the teams. I don't know if Chris, you or Lauren have that right now, but I know we had 2 middle school soccer teams, volleyball, part of 9th grade football.
Yeah, I could get the exact numbers, but we've had 5 teams that had to quarantine at some level throughout the fall season, and just for some duration.
Right, that's what I mean. Because it was we start to think of avenues of, because we're trying to kind of shut all these doors, right, of avenues of bringing it into our buildings.
Right.
And having a sense of how many doors we're dealing with that are part of sports, I think would be helpful information.
Great. Yeah, we did have 5 teams this fall that were on a level of quarantine. And of those 5 teams, of those individuals within those 5 teams, only 1 student athlete experienced COVID positive case.
Result. Okay.
Results. Thank you.
Thanks.
Dan?
Yeah, thanks, Amber. I just want to thank Amy for bringing up an idea that occurred to me this afternoon. I got 3/4 of the way through an email and then decided I didn't want to add anyone's burden at this point, but I was asking essentially the same question. Because in one of the emails we received today from regarding the wrestling schedule. It was and not to demean anyone, but their focus was on their kids' competition and playing. And they incidentally mentioned the risk for COVID infection, but and they asked the question, how has that impacted our athletics program? And then it led me to ask the same question, which is how have this risk, how has it impacted the experiences, and not just in terms of those who were diagnosed, but in terms of those who were quarantined or in other ways had their schedules impacted by this disease in the fall and however they were exposed to it. So the scale of that, I think, is a very important question to try to answer. And behind that is another, and I've kind of asked this before in earlier conversations about this. What amazes me is that even though we're all struggling with this, the fact that we're having this conversation and I'm seeing everyone on this 8 by 10 inch screen, it's just one more example of the way this is intruded into our lives. And I think those who are advocating, obviously they want the best for their kids. They want their kids to have all the fullest experience they can possibly have during their high school years. But I wish that in these requests that are made, in these ways of thinking about it and talking about it, people have give one voice to the need of their dream of their kids having a full experience, but then recognizing how does it have to be adapted or accommodated through mitigation experiences and routines so that they and others with whom they're competing are safer. Not perfectly safe, but safer. And I wish that were part of the conversation. And we wind up with these binary requests for making things happen on this day, on this date, in this way, and without much consideration that that we can't have it that way right now. We might in a year, but we're not going to have that right now. And I sometimes feel, and I don't mean to be too disparaging, but I feel like we're the only adults in the room when it comes to some kind of providing leadership on these kinds of things. And by we, I mean those of us involved with this whole process, all of us having this conversation today, all of us in the school district to work every day to manage the mitigation strategies. And that's that we're more kind of a recognized need throughout the community so that we weren't faced with these binary expectations that yes or no, up or down, for or against, but recognizing that we can't all have it all the same way in this present risky environment in which we live. So that's all that I wanted to say. But I wanted to reinforce Amy's question. I think it'd be good in terms of offering a baseline to this family today who asked the question that they did, but in terms of future questions so that we can inform the community, inform the athletics community about what the impact of this has been in terms of the experience of students up to this point. I think that's an important question to try to answer. Thank you.
All right. Amy, I see your hand up, but I wasn't sure if it was just still up. Okay, Scott, and then we should probably wrap up because we've got a few other agenda items.
Yeah, I'll make this quick, and I don't want to appear argumentative, but I would encourage anybody who thinks that the athletics community is taking things for granted to actually attend a practice or a game and see what these kids and these parents are going through on a daily basis, just to try to have some small semblance of normalcy to what they would like to have. And Chris mentioned 700 kids, 700 student athletes that participated in the fall. Those are 700 kids that had experiences that might have kept them from doing other things. And we've talked about the risk associated with being secluded and not getting out and being locked down, and what the cost of those activities are. And I would just encourage those who think that the athletics community might be taking this lightly to go to a practice and to go to a game and to talk to some of those parents and see how their schedules are completely, just on a daily upheaval with games being canceled, practices being moved, et cetera. So, I don't think that community is in any way taking this lightly or looking at this as, an up or down or black and white decision.
I as we conclude here, Amber, I just wanted to share, like, all of our winter programs have been practicing, working out, doing things in the off season in spaces that they can find. A lot of our student athletes compete through clubs and other means. I'm a fan of all of our extracurriculars. I'm obviously not a wrestler, but I'm a fan. And I know we have had a bunch of student athletes that have been competing through the summer and fall, and right now they've been working out quite a bit. Most of our team has been working out in another facility, and some of those student athletes have been working out almost daily in another facility. And I know how hungry all the student athletes are. I only know that because I saw some of the student athletes recently and asked them some questions. And I appreciate their candor of what they've been doing. We obviously, when student athletes are in our programs, we're requiring our coaches to do all of the screening, including temperature checks and things. It's not foolproof, but those are steps that are happening because they're with us. And then also, I think Chris and Lauren have done an excellent job helping the coaches to stay the course and communicate with us when they did have questions and concerns. And we want that open communication. That was what caused us to be able to make some quick decisions in the fall. So I just wanted to share that. I think that's important. I think, we can come back to this before we bring it back to the full board. We have some committees that do meet between now and December 7th. So, I'll ask Amber and Amy if we can take a look at our agenda planning and then look at some of the refinements that come out of this conversation and make sure we come back through committee before we bring something back to the full board. And then finally, I know I screwed up on the basketball court dimensions. I had some people texting me. I'm a math person and I don't remember all those details, so I should have never said it. So thanks.
Okay. So moving on then to item C, under fiscal stewardship, which is the 2021-2022 budget development. This is shown in attachment 6C, and I'll turn it over to Randy Brown to introduce this item.
Thank you. Donna Watson's with me here tonight as well, just to ensure that I don't miss anything. This was an item of discussion at our latest finance committee. It is just a opportunity for you to review our budget development calendar. What we've tried to do this year is to include in that calendar not only the important dates and deadlines according to PPE and Act 1, but also to put in the board action items and decision points. We've also begun discussing the various focus areas for our budget process this year. And as we shared with the Finance Committee, this year is obviously like none other, and we need to focus on a great amount on areas of COVID, areas of instructional model, instructional model flexibility, not only for this year, but also for next year. So what we expect to have for you is a preliminary budget at the December 7th meeting. And then we would ask that you would take one of two actions. Either you would adopt that preliminary budget or you would adopt a not to exceed resolution. We understand that that not to exceed resolution is very important in your decision making, because it will cap your ability to raise taxes for next year. And then obviously there is also a future year impact on any tax increase and future tax revenue generated from that, because an increase sets a millage, and then that millage sets a base from one year to the next. However, this year, as we know, because of the pandemic, there was no tax increase, and there are areas of revenue concern, and there are areas of expense that we have needed to be prepared for. And we have received some federal funding. We're very grateful for that. We continue to reach out and look for other areas of revenue resources. just at the last meeting, in case you didn't remember, or for those watching, if they weren't aware, we did approve the acceptance of a grant from Center County of some federal CARES monies from the Center County government. So those are the important, I think those are the important items for tonight's discussion. Be happy to answer any questions or add any clarity to any of those, any of that discussion.
Laurel?
Thanks. This actually is to David. I'm wondering, because you mentioned the budget, the possibility that they do a 2-month budget. If you have any sense from your dealings when and if we might know what the status of that is going to be?
They have to do something before the end of December, and they're not going to want to run it right down to the end of the month. So that, my best guess is by mid-December, they'll come up with a continuing resolution to get us until February, and then keep your fingers crossed.
I mean, that's always my concern with the opting out, is even though I don't expect that we'd exceed, go the community for that.
Yeah,
is
well,
make those decisions when we don't know what we're getting.
yeah, if it's us, it's also 499 other school districts, and I can't imagine they're going to leave everybody hot. So
Okay, thanks.
yeah.
All right. Any other questions at this time?
I would just like to also say that the CAC for Finance has, because of the pandemic, has not had a lot of activity. However, we are preparing to have them begin meeting in a remote manner, in a way to gather input from community members. I believe most, if not all, of the current members on the committee have agreed to continue to serve. We are reaching out to some individuals in some specific areas of the community where we believe that we are missing some representation, but this is also a formal plea and offer that if anyone listening, or if anyone is aware of someone who might be interested in joining that committee, should reach out to me directly in the Finance and Business office. And we'll also be putting something on our website and maybe doing some outreach as well. So board members, that also obviously goes for you as well. We're looking to expand that committee and get it rolling. I think we're looking at an early December meeting.
Randy, is there any particular, I know you said you lost a lot of people, but is there any particular expertises that you would be looking for?
I got some names. I'm looking for a realtor or someone in real estate. And I do have a couple names of individuals right now, but if there's any others or anyone listening or that's watching, we would be happy to take those. Really, pretty much anything out there. We have representation from Penn State. We have some banking, and we have some other small business. But honestly, I appreciate the question. But definitely someone in real estate is something that I think that would be very helpful, especially because my knowledge of the real estate at this point in time is just what I see out in the world, and through the property transfers that I read in the paper.
Okay.
Okay, thank you. Okay, then moving on to item D, the 2021-22 academic calendar, as shown in attachment 6D. And I will turn this over to Dr. Stout and Mr. Bach to give us this update.
Sure, this is going to be a pretty brief update, but what we're asking for is if we can extend the deadline for bringing a proposed school calendar for the 2021-2022 school year. The calendar resolution requires that we or strongly suggest, I will say, that we bring a draft calendar to the board no later than December 1st, and then the board will adopt a final calendar no later than January 31st. Due to the pandemic and the multiple changes that we had to make to this current school year calendar, we'd just like a little bit more time to see where we're at with the virus and the pandemic and the development of our school calendar for next year. So I think we're asking in here, I don't know if we put a date, yeah, that we would bring the calendar to the board in February. Now, I will say we're scheduled to meet with the calendar committee next week, either Monday or Tuesday, to have our initial discussions and start getting their input on a calendar for next year, but we don't want to rush something through at this point.
I don't know if we need an action on that because it's a resolution. It's not a policy, but it is a practice. And we wanted to have the conversation with you, see what you think. I'm also comfortable if you put any dates like that in the policy, because every time we talk about the resolution, we start asking, hey, where is that PDF file? So I think it would be ideal to have any type of expectation from the board in the calendar file. Not that I want to work on a calendar policy right now.
Questions or feedback on the timing, Laurel? Oh, you're muted, Laurel.
Sorry. Is there any state law on when we have to adopt the calendar?
I'm unaware of any. We could look at it. If there is, it's linked to our policy.
Okay. Hi, Scott.
Hello, there is no state law on when you have to do it.
That's all I needed. Thanks.
All right. Any
So-
other?
I think we should take as much time as we need to be the most informed we can.
Mhm.
I was going to say, how about April 1? I mean, there's no question, we may be in February and say, hey, things look like they're turning, but we're just not, we'll see. But I think if we come forward in February, when we chatted, as Will said, we'd appreciate the time to better understand.
Mhm. Okay. Then item E, under information discussion, is teacher support for the hybrid educational model. This proposal is in attachment 6E.
When we look at all the different educational model options that are out there, putting faculty in a hybrid model really is a challenge. You've heard that. We've heard that. We see it. And we really, if you ask faculty members what's some of the biggest challenges, most people are going to say time, number one. Managing it is a challenge. And so we've been discussing how we could help give time. And at the secondary level, PLCs just aren't able to meet right now because we went to the semesterized schedule so that there are less contacts in those schools. It was a big help with the safety piece and reducing contacts, but it caused us to have a real challenge with PLCs meeting. And since we're also, asking our employees who are parents to help us out with transporting their students, it's just not as easy as saying, we'll just have them meet right at the end of the school day or right at the start of school day, because we have a lot of employees that are trying to do the right thing and help us out. So it isn't as easy as it seems. We've looked at a lot of different options. Some of our teams are meeting at unique times, but to try to give people time is a big challenge. PLCs isn't the only piece to it. It's really comes down to having that planning time. And we've been looking at some different options. Obviously, during the colder months, it's not as flexible to have the students outside doing different things for extended periods, but we realize this is an impact on families. We didn't put specifics in the document because we want to see where we are during the next 2 weeks. But anything that we would do, we would give parents some lead time of 2 weeks or more, but we definitely need to do something for our faculty. And then moving on into the months ahead, we'll see what we need to do and what other options we might be able to consider. But there's nothing like having time when your students aren't with you and you're with your colleagues and being able to plan. Right now, everything they're doing, the buildings have a lot of students in them. And like I said earlier, that secondary piece, we took away something that was pretty important for our faculty, and that collaboration time where in secondary schools, you're working with teachers who are teaching the same content and the same grade age levels and things. So, asking them to do hybrid on top of taking that away at the same time, that really hurts.
Dr. O'Donnell, if I could add too, from the elementary lens, as board members, we came forward with a proposal to help our K-2 teachers provide some relief with additional staffing to break up the remote and in-person students. But our 3-5, we weren't able to do that. And that's been a recurring theme that I've heard as I've been out and about and meeting with teams and principals, is providing more time for our elementary folks, especially in 3-5, to have additional time for planning, to teaching and delivering lessons to both groups of students simultaneously.
All right. Questions? Okay. All right. Not seeing anyone raise their hand. Okay. So then what's the next step with this? Is you would just let us know about scheduling?
Yeah, I mean, it wouldn't require board approval. Scott Etter waited on that, but I do think we owe it to you and the community to, give as much lead time on something like this as we can. We would have put more specifics into it. We need to work some things out, and we also we really need to see where we are the next couple of weeks before we would commit to something during the month of December. Obviously, if we're in a remote situation, our approach on those Wednesdays does give us some time. So we wouldn't want to be planning for this if we're in that remote situation.
Oh, that makes sense. Dan?
Yeah, I mean, since you're asking for opportunity for questions or comments, I just want to acknowledge that Dr. O'Donnell, this makes a great deal of sense. And from just when I first learned of the pathway we were following at the beginning of the school year, it did occur to me, and I've heard since that this has been a source of stress. And so I think this is very responsive to the needs of teachers. And you just can't underestimate the importance of planning time. Planning time is such a powerful resource for teachers to have. So I think that to the extent that we can accommodate and provide this kind of support, I think it's all good. That's basically it. Thank you.
Okay. Laurel?
Yeah, echoing what Dan said, I'm a little concerned that we somehow embarked on this knowing that the PLC time wouldn't be there and haven't come up with something sooner. So it's good to have it now. But I'm trying to get the distinction between planning time and PLC time. And the question is, who would direct the use of this time? Would this be some time that the teachers had and could decide how to use it? Or would the direction come from the district as to how they are to use it?
I think it's a conversation with your principal and teachers, and what do teachers, I mean, the point would be, what do you need? So I think the voice of the teachers and how we would structure the time would drive that. I don't think we're sitting here saying because if a PLC wants to meet that day and utilize that time in secondary, great. Elementary, they may not want to do that because circumstances are different. Because we've been able to have PLC time there, but we've actually, given flexibility to that time where we've changed up, the elementary principals have changed things up just to try to be as flexible as possible with faculty because of the challenge on their plate with the hybrid model.
Thanks.
Right. Any other questions? So we'll move on to item F. Under policies, we're looking at policy 6, the policy on meetings, and this is shown in attachment 6F. And Linda, I'll let you provide a little overview here.
Thank you. This is a policy we've been looking at in the Policy Development Committee for quite some time now. The committee had a couple suggestions for changes they wanted to make. Then we decided to get involved with the PSBA review. They gave us quite a lot of suggestions to take a look at. And we ended up with what we have in front of you. This, as is stated in the cover letter, a compilation of both the committee recommendations as well as the PSBA recommendations that the committee's moving forward. There are 2 areas. This is something new and different for me. I don't know if it's new and different for you. We have 2 areas where we are giving the full board choice in the section called public participation. There is the PSBA recommended language. And then there's the language that the committee developed with the help of Scott Etter. So our question is, which option do you prefer? The other area where we have choice, the discussion item of how do we want to go forward with moving an item from information and discussion at a board meeting to action. We actually have 4 options for that in the voting section. So I'm hoping that with all the PSBA changes and our options, this wasn't too terribly difficult to follow, but let me know if you have any questions. So it's all really clear.
Amber, I think your mic was muted when you called on.
Oh, thank you. Scott, I'm sorry, I called on you, but I was muted.
Okay. So the only question I had was related to moving an item from information to action. And I guess I don't quite follow the 4 options. I'm just looking at number 5, which has 2 options, which are listed as option 3 and 4. But my overall thought on it is that, and I, correct me if I'm wrong, but I kind of thought we had a discussion on this at some level in a committee or board development or something like that at one point in time, where I thought we effectively said that it shouldn't require a unanimous vote because it wouldn't really be appropriate for a single board member to hold up that majority consensus. But I also thought that there was some conversation that if there was a movement of an item to action, that it would require a majority as if the entire board was there, so that you also couldn't have a situation where you had a quorum of 5 and 3 of the 5 voted, or even all 5, whatever, voted to move something to action, and then you had action on an item with a vote of 3-2 on something that could potentially be of significance to the board, with effectively 3 people approving it. if that makes sense. So I believe, I just seem to remember, and maybe it was a nightmare or a dream, that there was some conversation about it. But again, I specifically remember kind of that removal of the consideration of a unanimous decision, but that from there, it was a structure to try to say, we want to move something to action in the same way that it could have been approved by the full board. So that would, whether we actually had that discussion or maybe it was a smaller discussion, that would be my approach to that conversation.
I feel like I vaguely remember that discussion at one point as well. Lori?
Yeah, I wanted to say, we did have a small discussion about that. It was in the midst of a larger discussion in which this was a question. And we're presenting all of these options because we never really came down on any particular decision on that matter. And because it's in policy, we wanted to try to codify it in a way that suited our practices or well, in a way that would suit what we believe would be our best practices. So, yeah.
So I'm going to try and make sure I get this right. The 4 options are to include it in number 2 under voting, which means that 2/3 of the full membership of the board would need to approve it. The second option is to include it in number 3, which means that 2/3 of those who are voting, assuming there is a quorum present at the time, would be needed to move the item. And then the third option is number 5 under voting. And that, I believe, is what you were talking about, Scott, but I'm not 100% sure. But it would be the affirmative vote of the majority of members who are present.
So
Then the last option, number 4, is what has been discussed in some of the full board meetings, where it can only move forward if all board members who are present agree.
So thank you for that clarification. For whatever reason, I couldn't follow the way the movement of items from information discussion existed in all 3 places with the addition of item 5. So that makes that much clearer. So for me, I think that having that under option 2 would be the most, item 2, having the option under item 2 would be the most consistent treatment to as if the item showed up under action normally. And again, I'm not trying to, in some way I'm trying to be devil's advocate. I'm trying to think of the situation that avoids any cutting of corners in the intention of how something would be approved at the board level based on kind of a backdoor maneuver of moving an item to action when certain members aren't present. That's what I think that's where the reality.
I'm in general agreement with the general concept. Laurel?
Yeah, thanks. I'll address that one first. I've been pretty vocal about thinking that if we think even about tonight's agenda, for instance, suppose there was someone sitting at home who looked at the agenda and said, oh, I'm interested in this thing on sports. I want to hear what everyone says. I'll get in touch with the board members in a couple days after I've thought about it, and woke up tomorrow to find out that we moved it to action tonight. I think once something is on, anyone could introduce a motion, but when we've put something under discussion, it's usually because it's an issue that's come up. And people see that and should be able to count on the fact that they will have a chance to weigh in. That's why I have felt that even if I think it should be used very rarely that we move things to action. And if even one person has a hesitation, there have been a number of different reasons that people have hesitated on things. And I think that even just one person should be able to say, hey, I want to look into this more. I wasn't prepared to vote on it tonight. So that's my feeling on that one. The other thing I had noticed in here that I didn't remember before and I wanted to ask about was abstentions, because there's something in here that you may not abstain, and I don't remember seeing that when we talked about it in the policy meeting. I just went back and didn't see it there, but I may have forgotten the conversation.
That is one of the PSBA suggestions.
Suggestions, okay.
Mhm.
So they're the PSBA ones are in italics.
I'm not positive that this might not be school code though, because I remember reading up on abstention, and I don't think you're allowed to abstain unless you have a conflict of interest. If you have a conflict of interest, then you can abstain, but otherwise
You must abstain.
Scott's on. He can
Yeah.
wait.
I've written opinions, including to State College, about this in the past. And there's a case, I want to say out of Wisconsin, I haven't looked at it or written one lately. I think it's a case out of Wisconsin that speaks to the issue. You're elected as board officials, and unless you have a situation where you're required to abstain, or you have a spouse or something of that nature who's part of a collective bargaining agreement where you can technically vote, but abstention in that situation is understandable. You should vote, is my opinion, but there's nothing that we as the collective board, to include the administrators and me, can force someone to vote on an issue where they wish to abstain. So would like you to, but we don't have any legal authority to force you to.
So Laurel, I retract what I said. As I'm looking at the document, obviously this is a very long document with an awful lot of changes in it. It appears like this was a committee suggestion, yes.
Because the italics is how I had.
Right, right.
So I don't know how I feel about it. I just didn't remember talking about it, so I did want to ask about it. The other thing I wanted to say a big yes on is adding the opportunity to communicate via email. We did talk about that. It's in here. I think it's the right thing to do.
Dan?
So just to be clear, this is considered the first reading,
Yes,
and we would need to do this again
yes,
to come to a final agreement.
yes.
I'm just thinking about this out loud, whether, and I don't want to, particularly for Linda and Lori, I don't want to get in your way as kind of the leaders of this process, but I'm wondering if for those who have specific preferences for specific elements of this, that they can get in touch with certainly any members of the policy committee, but especially with Lori and Linda, to specify what their preferences are and have a discussion about them and try to turn it into something which we wind up choosing from later that would be a narrower set of choices, a more refined formula that we'd be reacting to. What do you think?
I think that's a great idea, because as we were thinking about presenting all of these options, I was sort of stressed out about how we would actually go about having a vote on the policy. And that's just one example. So yeah, I would be absolutely happy to receive thoughts on this, and then be able to present maybe a couple different versions based on what, if two clear winners come out of this, then we'll have something tangible, and then we won't be talking about four things. We'll only be saying it's between these two particular options, something like that.
Just trying to narrow our focus a bit. That would be great.
Oh, I totally agree.
Thank you.
Yeah.
I have just like a couple little wording things. So I can just send those by email probably.
Yeah, whatever. That's fine, Amber. Sure.
Laura?
Thanks. I had one other question. And that was about the standing committees. There's something that says standing, and it's standing is emphasized. Committees will be public, which would seem to me to indicate saying that if you had an ad hoc committee, the meetings could choose to be not public. And I wanted to ask if that was the intent, if I'm over making more of it. I just,
Which line are you talking about?
sorry,
Laura?
it's, I'm juggling the different screens here. It is under, it's on, we need numbered pages. It's the next to last page, towards
Well,
the
that-
bottom of the next.
Under committee meetings.
Yes, it says,
Right.
it's the third paragraph.
So
It says standing committee meetings.
you mean because it's bold and underlined?
Right, as opposed to committee meetings.
That's because that is a PSBA suggestion. It would be normal text if it was accepted by the board.
Right, and I guess I'm saying that I'm concerned about specifying standing because then it implies that if it's an ad hoc committee, it could be closed to the public. I'm not sure that was actually the intent, but that's what it says to me when we emphasize standing but not ad hoc. Or just committee meetings shall be open.
I'm sorry. I misunderstood what you said at first.
Okay.
Yeah, I appreciate that potential interpretation. Yeah, because what other, by being specific, you're excluding everything else. So I get that.
So we'll send any comments we have to Lori and Linda, and this will come back for another reading. Do we want it to come back again as information discussion before it comes back as an action item? Would that be helpful? Since there's a few different, like maybe we could bring back a proposed version.
That's a good idea.
Yeah, I like that. Yeah.
Yeah.
It would be ironic if we brought it back as information discussion item and moved it to action. That would be very ironic. So let's just bring it back as an information discussion item.
And then let's see where it goes.
Let's see what happens.
I look forward to your motion, Dan.
We'll just wait and see, right?
Yeah, let's see what happens. See where it lands.
Okay, so we'll bring that back. That'll be an information discussion item again before coming back on a subsequent agenda for action. Okay, so item G on this agenda under action or information discussion is items for the reorganization meeting. And so we just wanted to make sure that we had everyone's committee preferences ironed out. I don't know that we need to talk about it at the table this evening, but if anyone has preferences or changes in regard to their committee assignments, to just make sure to reach out, and we'll make sure that's all organized before the next meeting. Jim.
No, I just wanted to have everybody, including the public, check the dates. So we have among those the dates for proposed meetings in the 2021 calendar.
Mm-hmm.
So check the dates, see if we mess anything up.
Yeah, and there's a few dates because of holidays that are a little bit off in this calendar. So just from our ideal. Okay, so moving on to board committee reports. The only committee meeting I think we've had since our last meeting was finance and audit. Scott, is there anything to report from that aside from what's in the minutes?
No, I mean, and not only what's in the minutes, but what we already went over this evening.
Mm-hmm. Okay, so upcoming committee meetings are listed here on the agenda. Board reports. Dan, do you have a central intermediate unit report?
Yeah, I'm not sure if I've gone through this before, but we did meet on October 22nd, and we will have IU board meeting this coming Thursday, but there were a number of elements in that board meeting, some of which dealt with the health and safety agreement. They developed agreements with individual non-public schools that are served across 3 counties, which was something that was really appreciated by our staff in terms of having predictable protocols in working with each of these schools for their safety. So that was an important step to follow. We also purchased some hardware and such for mitigation in some of the facilities, HIPAA filtered machines and things like that. Jeff Straub came and spoke with us and offered a proposal for a new facility at the West Decatur location. And we also heard from Dan Berger, who's the director of instructional technology, who reviewed the elements of the RUST grant, almost $1 million grant that we received for developing hardware and training for technical communication between school district facilities in IU10 and IU9. And those essentially were the big ideas out of that particular IU board meeting.
Thank you. NSBA, PSBA reports, David?
No, I pretty much covered it earlier.
Sounds good. Scott, do you have an Ed Foundation report?
No, I was not able to make the last meeting. The agenda was fairly light. And is Randy still on?
Yes, I am.
Randy, was there anything of any great substance in that meeting? Did you attend?
Yes, the largest thing was that the foundation board accepted the administration's recommendation to not have a fall grant application process for their student opportunity grants. And they agreed to provide resources to help the district provide some additional equipment for teachers that has been requested to help with the hybrid and remote instruction. They are very interested in returning to the grant application process in the spring, and we expect to do so, but just given all that the teachers were going through right now and the need for some microphone equipment and monitors for the teachers in their classrooms, they agreed to help fund that initiative. So that I understand that some of the monitors began arriving today. And as soon as the rest of that equipment is here and available to be dispersed, we'll get that out. Teachers have already been surveyed and had an opportunity to select which equipment, or if any equipment, that they needed to help with their instruction. So we're very appreciative of that because that will help a greater footprint of teachers in this time. And it also allows them to receive that without going through an application process.
Great.
That was it.
Okay, thank you. That makes sense. Do we have any CAC reports from Jim?
I'm muted. I'm unmuted now. No, just one thing to report. So I'm the board liaison to the CTC, and we had what's called our it used to be called our general advisory committee. Now it's called the local advisory committee last week, and it was the first one that Dr. Ben presided over, and he's got some ideas. The fortunate thing that came out of that is we were due for an audit in 2021. And because of the pandemic, it's been pushed off a little bit. So it's good for Dr. Morton because this is the first, this is his first, 6 months in the job. So it's good for him to, help get him up to speed in the meantime. And he also did have some suggestions for changes. We meet again in the spring. Suggestions for changes to some of the programs so that we're more compliant with the state required number of hours for completers and certificates. So that was just a general thing that happened on that. And then the other thing is that we have a CAC for technology tomorrow afternoon at 5:30.
Great. Thank you. Any other CAC reports? Okay. Then looking out to future agenda planning, our next meeting is December 7th. And with that, oh, I'm sorry, public comment. If anyone who is here who would like to make a public comment, each individual is limited to comments of up to 2 minutes as time permits for items either on the agenda or related to board business. Shay McGowan, I see your hand raised. If you would like to unmute yourself and introduce yourself, then you'll have 2 minutes.
Good evening, Amber. My name is Shay McGowan, and I am here to speak on behalf of the more than 600 members of the State College Area Education Association. While the increasing COVID numbers in our schools is weighing heavily on my heart tonight, and the health and safety of our schools is always my #1 priority, I am here to specifically address item 6E of tonight's agenda regarding additional dedicated planning time for our educators. Let me first thank the administration for being open to the countless conversations regarding the ways we can further support our educators working under the incredibly challenging conditions in our schools this year. Granting this professional time to occur during the school day will allow for critical collaboration and curricular work to occur as we work to give students the best learning experiences in the COVID paradigm. Currently, much of this work, which includes creating classroom materials for remote learners, collaborating with grade level colleagues, investigating new hybrid teaching tools, recording lessons, and planning asynchronous activities, in addition to all the regular work that is done in a traditional school week, occurs on weekends and evening hours, which has stressed our teachers to their breaking points. Additionally, now more than ever, our educators need time to devote to loved ones and their own overall well-being. Shifting these efforts to occur during the work week will be a benefit to all. This effort is a good additional step towards helping our teachers, similar to those demonstrated by support and modifications made in the K-2 classrooms. We are hopeful that these types of supports will continue to help grades 3 through 5 classrooms, the curriculum review process, elementary specialist classrooms, and our special education department. Thank you.
Thank you, Shay. I appreciate your input and taking the time this evening to speak. Ari Giros, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Can you hear me? Is this better or not? Okay.
Oh, now we can't hear you. Oh, I'm sorry. I think we lost you again. We cannot hear you.
That require. Also, I would like to thank Mr. O'Donnell for emailing me about the school staying open or being closed. And also, I would like to thank all the special ed teachers and you and everyone on the school board committee. And also, I would like to thank the counselors, the special ed teachers, and everyone for their time during this pandemic. I know it's been very hard. I know it's been very tricky. But please realize we as special ed people would like to stay at school as long as we can. If we have to go remote, we as special ed should consider switching to instructional support centers as fast as possible if we can, whatever you want to do. But we really need to think about the COVID numbers at the school and at our own community. Please, let's make sure that everyone's safe please make sure everyone's safe along the community and the Penn State and everyone. The cases are rising, but I'm glad that we're here. We're not going to die yet, and everybody's safe, and we're quarantining and we're isolating and all of this. Thank you, everyone, for making our school safe. Thank you, Ms. Tonchion. Thank you to Mr. O'Donnell. Thank you to thank you for a special mention to Ms. Thank you for everyone for dealing with special ed students at this time.
Thank you, Ari. Thank you for your hanging in with us through the whole meeting to make your comment and to express your appreciation. Martin Wilde, I see your hand up. If you would like to unmute yourself, and then you'll have 2 minutes.
Hi, everybody.
Hi.
Can you hear me?
We can hear you.
Okay, great. Just to reiterate, thanks again for everything that everyone on the board is doing. I know it's difficult times, and I know it's a lot of competing interests. Just to reiterate, going back to the beginning of the school season, the board had laid out a safety plan. There were a lot of parents that really trusted in the logic of the safety plan, which was built around low community spread in person. If we see increased community spread, go remote. That was enforced earlier in the semester, and that has not been enforced recently. I understand because we haven't seen in-school transmission, but I just want to make sure that everyone on the board knows that there are a lot of parents in my situation that are trusting the board to make good safety decisions on the well-being of the children and also the teachers in school. And I realize there are certain families that really need in-person education because they don't have other options, but there are a lot of parents in the community that are that have that flexibility, but have trusted the school board with making that decision based on the safety interests of the kids and the teachers. And I just want to make sure that that none of these other competing interests. We heard some members of the board talk about the dark days of the pandemic and what we're seeing in terms of community spread. And I just want to make sure that everyone on the board is really focused on safety first, because what we're seeing, again, as this starts to grow in our community and what we're seeing with the local numbers, I just want to make sure that we're not making decisions that are based on accommodating the needs of people who are vocal opponents of staying in person.
Thank you, Mr. Weldy. Denise Cameron, I see your hand raised. If you would like to unmute yourself and introduce yourself, and then you'll have 2 minutes.
Thank you. I'm Denise Cameron with Ferguson Township. And first of all, I would just like to extend a thank you on behalf of the Football Booster Club for all the work that the health and safety team and the athletic department, for their leadership and their constant effort to allow us to have a fall sports and for that to take place. It was definitely a unique season, and we were faced with many challenges as the school, as the athletes, parents, and coaches, but everybody was all in whatever we needed to do to be safe and to mitigate everything. And it was still a great experience for the athletes. The kids still had a great time, great games. It was just really fun to see those kids on the field. And I really want to say, I think our athletes have redefined team. It's not just team, it's family. So I really appreciate all that everyone did to make that happen. The only other comment I do want to make is regarding the winter and spring sports. And in this discussion, I'm not really sure that I understood Mr. Duffy's comments. I think everybody's working together, and as parents, we know that these programs are not going to be the same as they usually are. But what we are asking for is to create paths and opportunities for the kids to play, and to be doing what we've been doing and what we did in the fall, which is to monitor how each of these things happen and how they go, and to make those decisions. I'm an employee, I'm a para, I work in the elementary schools. So I'm faced with challenges every day, and we see everything that's happening, but I'm a parent of a sophomore, and it's important for these kids to be in those activities. And
Thank you, Denise.
okay.
I'm sorry. Thank you. Thank you for speaking. And thanks for everything you're doing to support our programs too. I know you've been working hard with the Booster Club and also at in our elementary school. Patricia Wolcott, I see your hand raised. If you could unmute yourself and introduce yourself, and then you'll have 2 minutes.
So this is actually her son, Owen Wolcott from Patton Township, and I'm a senior and a 3-time team captain for the wrestling team. So yeah, I just kind of have 2 points in terms of winter sports and specifically wrestling. And then one is that one wrestling match is not equivalent to, a basketball game or a, hockey game or really, anything. Wrestling is kind of like on its own in that aspect. And so to compensate for that, it would, only be fair to, get more matches in. And so, if we can establish that that's important, then I think it would make most sense to, really open up that King of the Mountain dual meet heading into winter break there. Because I think one of the athletic directors actually mentioned that that cramming a bunch of matches into a short time period is, not ideal for our health as well as the competitive edge of our athletes. Like speaking personally, I plan on cutting 15 pounds this season. And so to, fit however many matches into a short time period is not going to have a great result, as I'm sure you could expect. So, opening that up into December, even if that just means having King of the Mountain, is going to be for the betterment of, our student athletes. That's kind of all I had there.
Okay, thank you very much for your comments. Okay, that seems to be all of the public comment for this evening. So with that, I would like a motion to adjourn.
So move, Grant. Second.
Okay, that's been moved and seconded. All in favor of adjourning?
Aye.
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 Anyone opposed? Okay, then we are adjourned.
Thanks.
Good night, everyone.